कर दिया है तो इस पर आ नहीं रहा है इस पर। ठीक है कर दिया है तो इस पर आ नहीं रहा है इस पर। ओके स्टार्ट करते चलिए। आ गया। Good afternoon, everyone. This is Dr. Aman Setia, Faculty of Medicine at FMG. So today we are discussing the expected topics of medicine. So these are high yield topics, which are like in exam they are asking again and again. So try to ask your doubts in the class also. Just now you can ask any doubts. Good afternoon, everyone. So this will be like a review class. We'll discuss all the important and high yield topics. Done? Okay, please join everyone. So starting with the first topic, that is called GIST. GIST means gastrointestinal stromal tumor. So this is like a tumor which is originating from interstitial cells of Cajal. It occurred due to c-KIT mutation or HDH mutation. So you can see this in a patient of NF1. The CD marker they ask in exam, that is CD117, and more specific. Jimesh ji. Hello. अभी ठीक है अभी ठीक ओके PDF will be available, don't worry. So CD marker is CD117. This is sensitive marker and specific marker. Specific marker will be dog1. PDF will be posted in the comment box, don't worry. Just focus on the class now. In biopsy you will find spindle shaped cells. Now they ask you like how you will manage this, कैसे आप इसको ठीक करोगे. So remember in GIST what is the treatment? The drug of choice will be TKI, tyrosine kinase inhibitor, that is the imatinib. तो याद रखना imatinib we use in two condition. Imatinib we use in two condition. Anyone? Saurabh, can you tell me any other condition और कहीं use करते हैं imatinib? Where else we use imatinib? Come on. Imatinib is used in two places. It is drug of choice in two conditions. First is GIST. Second is CML. So this is something which you should know about imatinib. Okay, then you will see always in exam there is always a question on CSF analysis or CSF study. So how to approach this question means they will give you a clinical case. आपको एक clinical question दिया जाएगा. In this they will ask you what is the diagnosis, and trust me you don't have to see the option. आपको यहाँ पर option नहीं देखना. So just try to understand this thing. What they ask you in exam, they ask you questions on like opening pressure, then proteins, CSF glucose. Now understand, CSF glucose is 2/3 of blood glucose. And last thing what they ask you is you need to see about the cells. Now just try to understand this thing. So we have three types of meningitis which we need to differentiate. So first will be pyogenic, also called as bacterial meningitis. Pyogenic, देखो ये क्वेश्चन हर बार पिछले 10 साल से एग्जाम में आ रहा है, वेरी वेरी इंपॉर्टेंट. पायोजेनिक और व्हाट वी कॉल दिस बैक्टीरियल मेनिंजाइटिस. second type will be your aseptic or viral meningitis, and the third type will be tubercular. So now understand this thing. In this type of question what you have to remember bacteria love sugar. So देखो protein pressure किसी भी meningitis से बढ़ेगा. I repeat, protein and pressure will increase in all meningitis, so you don't have to say this. First thing you will see in the MCQ will be CSF glucose. So remember bacteria love sugar. So bacteria will eat all the sugar. तो बैक्टीरिया CSF से सारे शुगर को खा जाएगा. So in bacterial meningitis sugar will be lesser. In bacterial it will be lesser. Now understand this thing. If you ask me like TB is also bacteria. तो देखो फिर से एक बार, in bacterial meningitis it will be lesser. So TB is also bacteria, so it will be decreased. Virus don't love sugar, so it will be normal. Done. तो सबसे पहले क्या देखना है? Sugar. Now coming to bacterial. When it is bacterial, understand it is bacterial, then cells will be neutrophils. So neutrophils, or they can give you PMN. PMN means polymorphoneutrophils. In case of viral and tubercular, it will be lymphocyte. So understand this thing. Just you have to see two things. बाकी देखो pressure, protein सब में बढ़ता है. Simple. Protein and pressure will be increased in all. Right? Yes, Saurabh, this will be effective for NEET PG as well. So here we have covered all the high yield topic which are asking in NEET PG FMG 9ICT exam. Done? So this is something which you need to remember about CSF. Very, very important. Ayushi, Saurabh, am I done? Clear? Okay, moving to next thing. They ask you question on what is the type of MI, which type of myocardial infarction it is. So understand this thing. In this type of question, what they ask you, you need to remember a mnemonic. That mnemonic will be SALP. SALP. So understand this. What is SALP? SALP means you have to see the ECG lead. आपको ECG की lead देखनी है. And you from this lead you need to see like ST segment changes, ST elevation or ST segment T wave changes you are seeing in lead V1, V2. Then it is like septal MI. If it is V2, V3, V4, then it's going to be entry wall MI. V5, V6, lateral wall MI. V7, V8, V9, posterior wall MI. And understand this thing, when you see lead 2, 3 AVF, this is inferior wall MI. तो अब आपको याद कैसे रहना? अंडरस्टैंड दिस थिंग. जस्ट रिमेंबर द सीक्वेंस. साल्प, देन हाउ टू रिमेंबर 1, 2, 3, 4, 5, 6, 7, 8, 9. सिंपल. 1, 2, 3, 4, 5, 6, 7, 8, 9. 2, 3 AVF, inferior wall MI. So this is something which you need to remember because this type of ECG based question they ask in exam. Okay, moving to next. We have pneumocystis pneumonia. So what type of question they ask in exam is, they ask you question like a patient is having HIV positive. So patient को HIV positive होगा. So it is actually a super infection in AIDS patient. And this will occur generally when CD4 count is close to 200. And very, very important thing understand, patient will have non-protective cough. So sometime in MCQ they will give you like, remember, HIV patient can have tuberculosis, it can also have streptococcal pneumonia, it can have any pneumonia. Right? So this is something which you have to remember. 3 सेशन आया नहीं रैपिड रिविजन का, तीसरा सेशन भी आएगा, डोंट वरी, इट विल कम. सो जस्ट आई वॉज लिटिल बिजी इन माई क्लिनिक, सो इसलिए नहीं आ पाया, डोंट वरी, दैट विल ऑल्सो कम. नाउ कमिंग टू ड्रग ऑफ चॉइस और ट्रीटमेंट. इन ट्रीटमेंट पार्ट व्हाट वी हैव टू गिव कॉट्रिमॉक्सोजोल. सो दिस इज समथिंग which you have to remember about pneumocystis pneumonia. Okay, moving to next thing. Now they ask you a question. बार बार एक क्वेश्चन आता है, which infection is commonly seen at which CD4 count, right? Now understand this thing. CD4 count when it is less than 500. वो भी कर लो, ये भी कर लो. It will not make a difference. Right? These are the high yield topics. So CD4 count when it is less than 500. Then you will see there is TB, herpes, both simplex and zoster, and Kaposi sarcoma. So these 3 infections will occur when CD4 count is less than 500, and when it becomes less than 200, then you will see infection with Cryptococcus, Cryptosporidium, and Toxoplasma. Now coming to when CD4 count is less than 50, then you can get infection of CMV, MAC, Histoplasma, and sometimes CNS lymphoma. And the CNS lymphoma in AIDS patient, it is done by Epstein-Barr virus. So these are opportunistic infection which you have to remember because ये एक वो question है जो बार बार आ रहा है. So these are one of the expected topic which you have to remember. Okay, now moving to all the hint in anemia, means they will give you a clinical case of anemia. So what are all the hint which you have to remember? So just let me elaborate few hint here. So starting, they will give you like a female patient in exam. Then this female patient more chance like she is pregnant, or she is taking certain drugs. Like these drugs they will give you in the option methotrexate, I'm writing in short MTX, or they can give you in the option phenytoin, methotrexate, phenytoin. MCV value is more than 100 because it's a macrocytic anemia. And understand this thing, for this we will do a test called Figlu test. तो अब मुझे आप बताओ which type of anemia I'm talking about. So these are all the hint. These are hint of which anemia? Anyone? These are hint for anyone? Folate deficiency. These are hint of folate deficiency. Now compare this in the MCQ. They can give you like a vegetarian patient. It could be a male or female, but vegetarian. Then they can give you, suppose they will not give vegetarian in the hint, they can give you a patient is alcoholic. Because understand this thing, alcoholic patient, they are having chances of developing pancreatitis. Or they can give you like a patient is having bacterial overgrowth. We call this bacterial overgrowth syndrome. MCV count here also it will be more than 100. MCV यहाँ पर भी 100 से ज़्यादा होगा. Then understand, you will see like patient is having MMA level will increase. MMA value will be increased in urine. And for this we can perform a test. This test is called Schilling test. So these are all the MCQs what they ask on. Yes, very good, B12 deficiency. Done. So we have discussed folate deficiency, B12 deficiency, B12 and folate. Now coming to what are other different types of anemia. So let's say they can give you like a patient who is a female with some autoimmune condition like SLE, or I can say it is associated with other diseases like ITP, immune thrombocytopenic purpura. Then understand, they will give you like in biopsy you will find spirocytes. And to make a diagnosis what we need direct Comb test. मुझे बताओ कौन सा anemia है. Tell me what is the type of anemia this. Shubham, Abhi, which type of anemia this is called AIH, autoimmune hemolytic anemia. Yes, spirocytes जो तुम सोच रहे हो, spirocytes are also seen where? Spirocytes you will also see where? They are also seen in hereditary spherocytosis. अब बात कर लेते हैं उसकी. Suppose they will give you in the MCQ like it could be like any age group, a genetic disorder. In this they will give you spirocyte. Then you can notice there is increase in value of MCHC, right? Then what else they will mention like patient is having like splenectomy is the treatment of choice. So these are the hint of hereditary spherocytosis. Okay, moving to next, what they ask you in exam, they can give you like a patient. There is a patient, suppose they will give you this patient is having red urine occasionally. Then there is risk of aplastic anemia, or basically I will call this risk of pancytopenia. There is risk of pancytopenia. Then it occurred due to DAF and Merle mutation. Or they can use CD marker. Like CD marker means CD marker for DAF will be CD55. For Merle it will be CD59. and there is gene mutation called PIG-A gene mutation. And to manage this condition, what we give in treatment, we give eculizumab. So these are all the MCQs. These are all the MCQs on which disease? Anyone? कौन बताएगा? Not multiple myeloma, no. Not correct. Anyone? और कोई बताएगा? eculizumab किस में देते हैं? Where we give eculizumab? Where we give eculizumab? No. Come on. PNH, paroxysmal nocturnal hemoglobinuria. Okay, moving to next what they ask you like patient is having, suppose patient is having ITP, TTP, HUS association, or they can give you any metallic valve or metallic implant, and in peripheral smear you will find, in peripheral smear में क्या मिलेगा? You will get something called helmet cells. Helmet cells. So this is something that you should know about MAHA. Microangiopathic hemolytic anemia. This is something that you should know about MAHA. Okay, now moving to next thing what they ask you. they will give you a question like a patient is having, suppose, dactylitis. So what is dactylitis? Inflammation of finger, dactylitis, or they can tell you like patients having autosplenectomy. Most common symptom will be bone pain. This bone pain is occurring because of undergoing bone infarction. Then patient will have priapism. So these are MCQs of sickle cell anemia. Moving to next thing what they ask you like hemoglobin H disease, HbH disease or hemoglobin BART. When there is absence of 3 gene, we call this HbH disease. Absence of all we call this BART hemoglobin. Now try to understand this patient. If you notice this patient who is having like HbH disease or BART hemoglobin, so this patient you can notice, this patient will have risk of hemolysis. So these are the MCQs on alpha thalassemia. And if you compare this with beta thalassemia, then remember, in beta thalassemia what they ask you Menzer index, very very important. So Menzer index value, understand, Menzer index value, if it is less than 13, more chance of thalassemia, and this value, if it is more than 13, then there is chance of IDA, iron deficiency anemia. Now last thing I will say, investigation of choice in any chain defect. Chain defect means wherever you will see problem in the hemoglobin chain, right? Wherever you will see problem in the hemoglobin chain. So understand this thing, whenever we see chain defect, in this case we have to do HPLC. If HPLC is not in the option, then answer will be hemoglobin electrophoresis. Okay, now understand this HPLC or electrophoresis, this is investigation of choice in any chain defect. Now we have to see where we have chain defect. So chain defect you will see in a patient with sickle cell anemia. Chain defect you will see in a patient with thalassemia. Both thalassemia, alpha and beta, both thalassemia you will see same thing. The same thing you will see where? In hemoglobin Punjab. Done? Dr. Kasantarun. This is hemoglobin Punjab. We also call this hemoglobin Punjab, or we call this like Los Angeles hemoglobin. So this is the rarest of all, means it is not as common, but it is like same again, यहाँ पर भी chain का defect है. So you will do the same thing, high performance liquid chromatography followed by electrophoresis. Done. Shubham, Kasan, Tarun, clear? Am I clear, guys? Any doubt in this? आगे चलो. Okay, moving to next. Now they ask you question on alcohol, a lot of question, right? Okay, now coming to this थर्ड सेशन कहाँ पर आएगा, नहीं यहाँ पर तो आ रहा है, देखो वो थर्ड सेशन मेडू हब का शायद अब नहीं आएगा, यहाँ पर हम करेंगे उसको, ये वाला सेशन को कर लेना आप, राइट. एक न्यूरोलॉजी का मेरा एमसीक्यू का आएगा सेशन, न्यूरोलॉजी का, वो मैं करूँगा 3-4 दिन बाद. डन. Okay, from alcohol they ask you a lot of question. So first remember we have Wernicke's encephalopathy. So they ask you in treatment part. So in Wernicke's encephalopathy what we give thiamine followed by glucose. So thiamine, like we see thiamine available in injectable form, in tablet form. So in Wernicke's, you know, like patient will have symptom like go. तो ये सबको ऑलमोस्ट पता ही है, ग्लोबल कन्फ्यूजन, ऑप्थेल्मोप्लेजिया, अटैक्सिया. ग्लोबल कन्फ्यूजन, ophthalmoplegia, ataxia. Moreover, what else they ask you? They ask you like alcohol से और क्या question? They ask you question on withdrawal symptoms. So मैंने थोड़ा सा space यहाँ पर रखा है for withdrawal symptom. So just I am using this space to know about withdrawal symptom. So understand this thing. अब आपको withdrawal symptom कैसे याद रखने हैं? So look at the screen. So suppose they will give you a question, last drink. So followed last drink. Last drink can understand 6 to 8 hours में. So you need to see the MCQ कि patient ने last बार कब दी थी, कब पी थी. So after last drink, understand this thing. Within 6 to 8 hours, the patient will develop a complication. 8 to 12 hours, he will develop something else. 8 से 12 घंटे में कुछ और होगा. Now coming to 12 to 24 hours, this complication even may worsen. Now moving to like anywhere in 24 hours to 72 hours. So understand this thing. These are the time limits, time frame which you have to remember. A psychiatry, medicine overlap MCQ. So understand. 6 to 8 hours में suppose आपने शराब पी 6 से 8 घंटे में, what you will develop? You will develop tremors. So patient will develop tremor. Now coming to 8 to 12 hours, patient can develop hallucinations. So here you will see there is development of hallucinosis, or we call this hallucinations. In 12 to 24 hours, then patient can develop seizures. These seizures, what we call them, इनको हम rum fits भी बोलते हैं. Patient can develop epileptic seizures. And lastly, understand 24 to 72 hours, this is the time where patient is developing delirium tremens. So ये क्वेश्चन जो मैं देख रहा हूँ ये बार बार नीट पीजी एफएमजी दोनों में आ रहा है. Am I clear? So this is something which you have to remember. Rum fits or delirium tremens. So this is something which you have to remember. Done? Okay, now coming to next thing. They ask you question on like different vitamin deficiency. Okay, so try to answer this. अब मुझे बताओ. बेरी वर्निकीज कोर्साकोव, ये तो इजी टॉपिक है. आई नीड योर पार्टिसिपेशन हियर. किससे होता है? डेफिशिएंसी ऑफ विच विटामिन? अभी तो पढ़ा ना. इट अकर ड्यू टू B1 डेफिशिएंसी और थायमिन. शुभम, कसंतन, वंडरलस्ट, कसन, तरुण. Am I clear? Okay, now coming to चिलोसिस. क्वेश्चन कैसे बनेगा इसको देखो. क्वेश्चन ऐसे बनेगा लाइक दे विल आस्क यू लाइक अ 35-year-old अल्कोहलिक पेशेंट सडनली हिज वाइफ is fighting with him, so he stopped drinking alcohol. After last drink, means he drank last drink 6 hours before, he is developing tremors, right? So that is tremor. Suppose they will give you like a patient who was a chronic alcoholic, all of a sudden quit alcohol, then he is developing like auditory hallucination. His last drink, so that last drink is very very important here. Suppose they will give you like a patient who is a chronic alcoholic, he is having confusion, altered sensorium, tachycardia, fever, diaphoresis, so that will be a case of delirium tremens, right? So delirium tremens, somewhere it will look like a shock like state. Okay, now coming to चिलोसिस, ग्लोसाइटिस, seborrheic dermatitis, ये किस विटामिन की डिफिशियंसी होती है बताओ? दिस इज ड्यू टू विच विटामिन डिफिशियंसी? एनीवन? कौन बताएगा? कम ऑन, ट्राई टू आंसर. एनीवन? इजी है ना? दिस इज B2 डिफिशियंसी, राइबोफ्लेविन, पेलेग्रा B3. पेलेग्रा क्या था? डायरिया, डिमेंशिया, डर्मेटाइटिस, डेथ. बर्निंग फूट इज B5. Now coming to sideroblastic B6. Neural tube defect and SACD. Neural tube defect, yes, B2 is riboflavin. SACD is very very important. This is severe, understand this thing, it is severe acute combined degeneration of spinal cord. So this is something which we see because of B12 deficiency, right? And just remember, this B12 deficiency is the cause of reversible dementia. Okay, now moving to markers. What they ask you question in exam, आपसे क्वेश्चन पूछते हैं मार्कर्स से. सो मार्कर्स मीन्स व्हाट आर द कार्डियक मार्कर्स. सो पहले तो मुझे नाम बताओ, व्हाट आर द मार्कर्स यू नो? What are the markers you know? So let me start with the first marker. We have, anyone? Heart specific fatty acid binding protein and ischemia modified albumin. बस आपको याद रखना है. They are not available in India, so they don't ask you. Heart specific fatty acid binding protein. Next marker is what we have. We have myoglobin. Then what we have? Troponin. CPK we have CPK-MB. Then what we have? AST, and last one will be LDH. So these are the markers which you have to remember. Now try to understand this thing. They ask you a question. These are the markers. AST को और क्या बोलते हैं? AST also called as SGOT. देखो, हार्ट स्पेसिफिक फैटी एसिड बाइंडिंग प्रोटीन एंड ischemia modified albumin, these are the earliest marker. Now they ask you a question like this is something which is not available. So it is not available in our country, so not being asked routinely. अगर आपसे पूछेंगे तो ये पूछेंगे, but important for NEET PG. So when they ask you earliest, you have to choose myoglobin. Troponin is overall the best marker. Even right now for infarction also troponin is better. Coming to CPK, तो आपको याद कैसे करना है? तो याद कैसे करना है, that's important. So the sequence is important. So remember this is, you can remember by mnemonic my the castle. Sequence. Am I clear? My the castle. Okay, now understand this thing is very very important. Markers in MI. Nitin, Abhi, Shubham. Am I clear? आगे चलो. Okay, now coming to absence seizures. So first tell me what is the drug that inhibit T-type calcium channel? कौन सा ड्रग है जो T-type calcium channel को inhibit करेगा? Then we will talk about different types of epilepsy and their management. बताओ, which drug? That drug is used in absence seizure. Anyone? Drug of choice for absence seizures. कौन बताएगा? What is the drug of choice in absence seizure? तो मैं आपको यहाँ पर कॉमन सीजर्स के नाम लिख दे रहा हूँ एंड यू हैव टू सेलेक्ट द फर्स्ट लाइन ड्रग. सो लेट मी स्टार्ट विथ फोकल सीजर्स. देन व्हाट वी हैव आई कैन से absence seizures. In absence we have two form: typical, atypical. Now what else they can give you? They can ask you GTCS, generalized tonic-clonic seizure, GTCS, and last will be myoclonic. Myoclonic. Okay, now understand. Let's see. So drug that inhibit T-type calcium channel. This drug is ethosuximide. Ethosuximide. Correct. Done. Okay, now understand. Ethosuximide किस में देते हैं? Typical में या atypical में? So in atypical what we use? In atypical we will use valproate. In typical we prefer to use ethosuximide. Done. Okay, suppose अगर मैं आपको बोलूँ what is the drug, one drug that you will choose in focal seizures, focal epilepsy. So remember एक टैबलेट आती है ऑक्सीटोल, ऑक्सकार्बेज़ेपिन. It is slightly better than conventional carbamazepine. Clear? So we can use oxcarbazepine or I can say carbazepine. Right? Then GTCS, बताओ GTCS में क्या दोगे? Myoclonic. Now understand this thing. Just what you have to remember, आपको सिर्फ इतना याद रखना है. Then there is one more thing, infantile spasm. It's like a pediatric question which they ask in exam. Infantile spasm. In infantile spasm, what we give? We give ACTH. And if it is associated with tuberous sclerosis, then we give vigabatrin. Done? अब देखो क्या बच गया. क्या बच गया? GTCS, myoclonic, and even in focal also. I repeat, even in focal also. In तीनों में, in all these three, wherever I am highlighting, understand this thing. In these three, there are two drugs which you can add as a first line. In fact, I can say three drugs. What are these three drugs? So understand this thing. Understand this thing. This is like these are the three drugs which we use in most seizure. तो जहाँ पर पहले हम valproate यूज करते थे, now in most places this valproate is being replaced by levetiracetam. So remember, this is first drug, levetiracetam. Second drug which you have to remember is lamotrigine. This is first line in every type of epilepsy. And third will be valproate. Am I clear? So what you have to remember, क्या रखना? Just remember, be it focal seizure, or it is GTCS, or it is myoclonic. So these three drugs you can add on. Done? राकेश, तरुण, समझ आई मेरी बात? नहीं आई? And remember, if you have to choose one drug which is first line in all types of seizure, so that is your lamotrigine. Lamotrigine हर तरीके के seizure में first line है. This question came in last year NET PG, and this now it can be asked in FMG exam. Very very important. So this is something which you have to remember about seizures. Am I clear, Rakesh? Okay, now they ask you question on HHV8. HHV8 means this is like a Kaposi sarcoma virus. Now मुझे बताओ HHV8 से और क्या होता है? This HHV8, anything else it will cause? We also call this KSV. KSV means Kaposi sarcoma virus. So this first thing it will cause is Kaposi sarcoma. कुछ और कराता है ये? Anyone? Anything else it will cause? राकेश, come on. कोई बताएगा? राकेश, कसंतन, शिवानी. Kaposi sarcoma कुछ और कराता है? Anyone? Open question to everyone. कुछ और तो कराता है ना? कौन बताएगा? लेट मी सी. एक लिम्फोमा कराता है? Anyone? कोई बताएगा? कम ऑन गाइस। एक लिम्फोमा कराता है। कोई बताएगा? एनीवन? कहाँ गए? सब गायब हो गए। अभी CMV होता सब बताते, आउल साई इंक्लूजन. So what else is caused by sarcoma? Come on. It will cause a type of lymphoma that what we call this. It is primary effusion lymphoma. Done. Okay, now moving to myasthenia gravis. So myasthenia से आपको क्या क्या याद रखना है? They ask you like a question on the investigation part mainly. Investigation part, to understand this thing, best investigation will be antibody. So antibody, what we have anti acetylcholine receptor antibody. Then we have anti-musk antibody, muscle specific kinase. And third what we have anti LRP4. So this is the best investigation. Then what else we can do? We can do single fiber electromyography. This is a sensitive investigation. Or we can do RNS, repetitive nerve stimulation. In repetitive nerve stimulation, you will see decremental response. And here you will see jitteriness. एक बेड साइड टेस्ट होता है, इसको बोलते हैं आइस पैक टेस्ट. And we can do a provocative test called tensilon test. So they are asking you question, and remember almost 60 to 70% patient they will have association with a thymic tumor. So thymus tumor means thymoma. देखने के लिए आपको और क्या कराना होगा? CT chest. So these are the investigation that we do in a patient on myasthenia gravis. Very important. So just remember Amitabh Bachchan had this. So you can see vertical opening of mouth. We call this snarling face. Then you can see this is called myasthenia gravis. You can see ptosis after giving hydrophonium. 10 mg एक साथ नहीं देते. We give 2, 4, 4. You can see ptosis will improve. तो इसको बोलते क्या है? Hydrophonium challenge test or tensilon test. Then remember this is again a snarling face. You can see vertical opening of mouth. Then this is ये अम्मा बार बार एग्जाम में आती है. You can see when you apply ice, so what will happen? Ptosis will improve. So what do we call this? We call this ice pack test. Then this is something which you have to remember about myasthenia gravis. Okay, now moving to stroke syndrome. So I want you to remember just this thing called Weber syndrome. Very important. So Anton syndrome occur due to bilateral distal PC occlusion. Gerstmann syndrome will have acalculia, agraphia, left to right disorientation and finger agnosia. Weber syndrome will have ipsilateral third nerve palsy and contralateral hemiplegia. ये exact question exam में already आ चुका है. Then they can ask you Benedict syndrome, third nerve palsy with chorea, Claude, third nerve palsy with tremors, and Milliard Gubler you will see 6th and 7th. ये NEET PG का question है. So these are the question what they ask on stroke syndrome. Right? Okay, now moving to blue bloater and pink puffer. So understand this thing. Blue bloater means bronchitis, pink puffer means emphysema. So just remember emphysema, you will see main symptom will be dyspnea. कफ यहाँ पर कम हो जाएगी. In chronic bronchitis, remember main symptom will be productive cough. Now understand this thing, because of repeated cough you will see purulent sputum, patient will be developing blueness, perioral cyanosis, so we call them blue bloaters. अगर मैं आपसे पूछूं which is dangerous, so remember bronchitis is dangerous because in bronchitis there is risk of right heart failure. What we call this? We call this cor pulmonale. And emphysema, understand here these bullas can rupture. Here you can see bullas can rupture. So this is dangerous for a reason. Like here you can see bulla rupture can cause pneumothorax. So there is risk of pneumothorax. What else you have to remember? Remember something which they ask in exam. For bronchitis you will calculate ratio of gland thickness is to total thickness, GT is to TT, and this ratio value will be more than 0.4. So this is what we call, इसको बोलते हैं read index. In emphysema, what they ask you, understand, they ask you question like patient will have barrel chest. Barrel chest means antero-posterior diameter of chest will increase. So increase in AP diameter. You will see increase in AP diameter, and what we call this barrel chest. So these are something which you have to remember. अब एक क्वेश्चन एग्जाम में पूछते हैं प्लूरल इफ्यूजन से. So there is a criteria called Light's criteria. So they ask you like which is exudate, which is transudate. So understand this thing. अब आपको समझना है any fluid which is thick, that's an exudate. So thickness कब आएगी? जब आप suppose understand this thing. Exudate is like a juice. Exudate is like a shake. Transudate is like a juice. Transudate is like a juice. So exudate thick होता है. So thickness कब आएगी? जब आप कुछ डालोगे. When you add something. So understand this thing. Suppose अगर आप दूध में या पानी में प्रोटीन डालोगे थिक हो जाएगा. If you add some fruit in this mango shake, thick हो जाएगा. So understand this thing. Thick means exudate. Simple. So understand in the I can say fluid, if you add some cells means cancer. So cancer का number ज़्यादा होगा. That so remember all cancer will cause exudate. Infection, again your WBCs will be high. So cells बढ़ गए. Collagen vascular disease or autoimmune disease, these autoantibodies can make it exudate. Then pancreatitis. So remember all the infections, all the cancer and all autoimmune disease. So this will produce exudate. Done? So आपसे एक पूछते हैं which is exudate, which is transudate. Okay, now they ask you a case-based question on cardiac tamponade. So cardiac tamponade से case-based question कैसा आता है? What type of question they ask you in exam? So let's start a discussion with this. So they will give you like a 50-year-old patient. A 50-year-old patient is coming to you with trauma to the chest, or I can say a gunshot injury, right? So try to understand what they ask you. They ask you like patient is having raised JVP, muffled heart sound. So sometime examiner may not use the term muffled heart sound, or they can tell you like patient is having diminished heart sound, right? And hypotension, patient का BP भी कम है. So what it is Bextrad. एक Bextrad साइकेट्री में भी होता है. एनीवन कोई बताएगा साइकेट्री का Bextrad? आयरन Bextrad. हिमालयन भाटिया का रिमाइंडिंग का जो क्वेश्चन है वो भी होगा. मैं इस वीक थोड़ा सा बिजी था, मे बी लाइक इन कमिंग दिस वीक 2-3 दिन में मैं कर दूंगा उसको, डोंट वरी. एक साइकेट्री में होता है Bextrad, दैट्स कॉल्ड होपलेसनेस, हेल्पलेसनेस, वर्थलेसनेस. Then in cardiac tamponade, understand what else they ask you question. They ask you like emergency treatment of choice. It will be emergency pericardiocentesis. 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 और कुछ पूछते you can notice like in X-ray you can see water bottle heart, water bottle or money bag heart, money bag heart. Then you can see a patchy area of dullness. This patchy area of dullness is what we call this Ewart sign. Patchy area of dullness is called Ewart sign. So अब देखो इन सबको and you can notice patient will have a prominent X or Y. Prominent X is more common and sometimes you will see prominent Y. दोनों मिल सकते हैं but X is more common. So now see what type of question they ask you in exam. They ask you like a 50-year-old person met a road traffic accident, then he's having hypotension. There is a patchy area of dullness on auscultation in scapular area, that is called Ewart sign. In X-ray you will see money bag or water bottle heart. So what is the diagnosis? Just remember यहाँ पर आपको heart sound दिखनी है, breath sound नहीं. Very very important. This muffling will be of heart sound. If breath sounds are muffled, that means that's a case of pneumothorax. So शारीरिक राकेश समझ आया, इसको कंफ्यूज मत करना न्यूमोथोरैक्स से. न्यूमोथोरैक्स में क्या होगा? ब्रेथ साउंड होगी. यहाँ पर क्या दिया हुआ? हार्ट साउंड. वेरी वेरी इंपॉर्टेंट. डन. ओके, नाउ सिमिलर केस दे कैन गिव यू प्लूरल इफ्यूजन केस. सो न्यूमोथोरैक्स इफ्यूजन. सो हियर फर्स्ट थिंग यू हैव टू रिमेंबर, ऐसा सेम ट्रॉमा से प्लूरल इफ्यूजन भी हो सकता है. सो हियर दे विल गिव यू लाइक यू नीड टू फोकस ऑन ब्रेथ साउंड. सो क्वेश्चन में आपको देखना है कि डिमिनिश क्या हो रही है, ब्रेथ साउंड और हार्ट साउंड। एम आई क्लियर? ब्रेथ साउंड और हार्ट साउंड, वेरी वेरी इंपॉर्टेंट. Okay, now this is again a topic which they are asking. OHA means OHA से बार बार एक क्वेश्चन आ रहा है एग्जाम में. Oral hypoglycemic agent. So just I am writing the names of certain drugs and what you have to remember the points in favor of this. So first I am writing here biguanides. Biguanides. Then second drug what we have sulfonylureas. Sulfonylureas. Third drug will be thiazolidinedione. Thiazolidinedione. That is rosiglitazone, pioglitazone. Then what we have alpha glucosidase inhibitor. Alpha glucosidase inhibitor. We have SGLT2 inhibitor. These are gliflozin. These are called gliflozin. Then what we have gliptins, DPP4 inhibitor. And what we have GLP-1 analog. एक मैग्नेटिनाइड्स को उतना यूज़ नहीं करते, सो दे विल नॉट आस्क यू. सो अंडरस्टैंड. तो व्हाट टाइप ऑफ क्वेश्चन दे आस्क यू इन एग्जाम, आपसे किस तरीके का क्वेश्चन पूछते हैं एग्जाम में, ये आपको समझना है. सो व्हेन दे आस्क अबाउट बिगुआनाइड्स मीन्स मेटफॉर्मिन, फेनफॉर्मिन, metformin. So understand fenformin is no longer used because of lactic acidosis. So just remember most common side effect will be GI upset. Then it can cause lactic acidosis. It can also cause B12 deficiency. Sulfonylureas, understand, like these are glimepiride, gliburide, gliclazide, glibenclamide. So these are the drugs which will cause hypoglycemia. Thiazolidinedione. So we have pioglitazone, rosiglitazone. So these are actually the drugs which are very effective in Indian population. पता नहीं कुछ reason है, because they are mainly affecting your centripetal obesity. So this drug are very effective. Just remember these drugs are something which is having some risk of bladder cancer, especially with pioglitazone. Alpha glucosidase inhibitor, acarbose, voglibose. Remember these are contraindicated in IBD. This can cause flatulence. It can cause flatulence. It's like in patients with ulcerative colitis, Crohn's disease, you should not give. Gliflozin, understand, gliflozin, they can cause UTI. Sometimes they will not give UTI, they will give you vaginal candidiasis. Then expected thing is it can cause euglycemic ketoacidosis. Now coming to these two are in the same group. ये दोनों same group में. Now understand, when these two are in the same group, so almost similar drugs, so there is chance they can cause pancreatitis. And remember, when they can cause pancreatitis, they can also, there is some risk of MTC. MTC means medullary thyroid carcinoma. Now understand, in OHA what is new thing they can ask you. बताओ क्या नया कुछ पूछ सकते हैं? Any new thing? Any new in OHA what they can ask you? कसान तरुण बताओ. Come on. Any new thing? कोई नया ड्रग आया? Any new drug? सीमाग्लूटाइड, ये ट्रेंडिंग है काफ़ी. रेबेल्सिस, ओजेम्पिक, करण जौहर, दिस इज लाइक वेरी वेरी ट्रेंडिंग ड्रग. एनी अदर ड्रग्स? Any other drug which we have for diabetes? Rakesh, Himalayan, come on. ये इसी को तो पूरी बॉलीवुड ले रही है अभी. Come on. Any other new drug? Tirzepatide, very good. यही सुनना चाह रहा था मैं. Tirzepatide, semaglutide. Any other? एक और बता दो. Semaglutide हो गया. Come on, one more. Any other drug? एक और होती, एक और नया आया अभी. One more. कौन सा एक और आया? कॉम्बिनेशन में है. कम ऑन. प्रामलेंटाइड तो पुराना, लीराग्लूटाइड भी पुराना. दैट्स ऑल्सो ओल्ड. टिर्जापेटाइड के जैसा ही है. प्रामलेंटाइड पुराना है, दैट इज फॉर टाइप 1 टाइप 2. दैट्स एन ओल्ड ड्रग. टिर्जापेटाइड काफ़ी फेमस हुआ था मोन्जारो नाम से. एनी न्यू ड्रग? कम ऑन कम ऑन. सोचो सोचो. फार्माकोलॉजी में लिखा है, हर सर ने पढ़ाया है, सब सब सारे ऐप के सर, सब टीचरों ने पढ़ाया है. एक कॉम्बिनेशन है. ओके, व्हाट इज द लेटेस्ट ड्रग? ओके, सॉरी, आई विल स्पीक इन इंग्लिश नाउ. Which is the newest anti-diabetic drug? Come on. Latest. Any other? Any other drug you know? Antibody है monoclonal. Come on. Teplizumab. So this is something which you have to remember, and remember they can ask you question expected on semaglutide because it is approved for obesity as well. Okay, now tell me the diagnosis. 2 to 4 days of abstinence, autonomic hyperactivity, tremors, delusion, hallucination. What it is? क्या है? Linagliptin is old, but now tell me what it is. What you can see. This is a case of, what is the diagnosis? They will give you like a 35-year-old person is coming to you after stopping alcohol 2 to 4 days back. He developed autonomic hyperactivity, tremors, delusions, tachycardia, hypertension, fever, confusion. अभी तो बताया था, this is the patient of delirium tremens. Delirium tremens. Okay, now understand. They ask you a question on ABG. अब आपसे एक क्वेश्चन ABG से पूछते हैं. So understand, in ABG, first thing you have to remember is normal pH value. So normal pH value is 7.35 to 7.45. Second thing you have to remember is PaCO2. It is 35 to 45. So understand this thing. पहले आपको pH देखना है, उसके बाद क्या देखना है? PaCO2. So when you see pH and PaCO2, this will be 35 to 45. And then just remember the rule. If they move in same direction, so same में M में, then disorder is metabolic. If they move in reverse direction, R for reverse, then disorder is respiratory. Once you see this, then ABG में उसके बाद क्या करोगे? Now what you will do? After this, what you will do? You will see like patient को क्या देखना है? You have to see whether patient is having pH. अगर सब PaCO2 बढ़ा, that is a respiratory cause, right? अगर pH कम है तो metabolic. Simple. Sometimes they ask you question on anion gap. So how we calculate an N gap? It is sodium value minus chloride plus bicarbonate. Now understand this thing, when you see this, you can see a value more, so this is called hagma. When you get a value normal like 6 to 12, it's called lagma, it's called nagma, normal anion gap metabolic acidosis. And when we get it low, we call this lagma. So high anion gap, low and normal. So actually this low anion gap is something which we need to be corrected. So this low gap, understand, it is seen in a patient of multiple myeloma, in a patient with lithium toxicity, and whenever we have low albumin. Low albumin means, where we see low albumin, in a patient with nephrotic syndrome. Nagma, normal anion gap, you can remember by mnemonic, that is called DRU. DRU means diarrhea, RTA, ureterosigmoidoscopy. And hagma you will see where cult. So cults means, understand, in cults what we have ketosis. Ketosis means it is decay. U for uremia, uremia means CKD, AKI, कोई भी डिसीज जहाँ पर यूरेमिया हो रहा है. L for lactic acidosis, L for lactic acidosis. Now understand, T for toxins, and S for starvation, and S for starvation and salicylate. S for starvation and salicylate. So this is something which you have to remember about hagma, nagma, lagma. Very, very important. Hagma, nagma, lagma. Very, very important. Done. This is something which you have to remember. Very, very important. Am I clear? Chiku, Abhi, Junaid, Thalasri, is it clear? This is something which you have to remember. Very, very important. You will get a question in exam from this. This is extremely, extremely important. I am repeating this again and again. Okay, now let's talk about pulmonary embolism. So first understand all the signs which you have to remember in pulmonary embolism. So what are the signs we see? They ask you a question on signs. So understand this thing. You will see focal area of polygemia, means जो vascular marking होगी वो कम दिखेंगे. That is what we call this Westermarck sign. So पहला sign. Yes, PDF will be available. Don't worry. So first sign you will see is Westermarck sign. So Westermarck sign means you will see like vascular marking will be diminished, right? ओके मैं इसका लिंक भेज दूंगा जुनैद. कंपनसेशन का भी टाइम नहीं है बिकॉज पूरा ये ख़त्म करना है. आई विल शेयर द लिंक जहाँ से आप कंपनसेशन वाला भी पढ़ सकते हो, राइट? मेरे यूट्यूब पे एक होगा, जस्ट सर्च इन द यूट्यूब अमन सेतिया ABG, तो वहाँ पे कंपनसेशन वाला पढ़ लेना. यू कैन सी डोम शेप ओपेसिटी. डोम शेप ओपेसिटी मिलती है, उसको क्या बोलते हैं? We call this Hampton's hump. Hampton's hump, right? Third sign, understand, you can see a right pulmonary artery will have a sausage like appearance. It will have a sausage like appearance, and this sign is called as Palla sign. This sign is called as Palla sign. Done. Then you can see pulmonary artery will look little bigger. We call this Fleischner sign. We call this Fleischner sign. Fleischner sign, right? Now understand, you can see the contrast will be cleared rapidly. So what we call this? We call the snow melting effect. Snow melting effect. Snow melting effect. Then understand, you can notice there will be like sometime you can notice basically it is actually a sign not of pulmonary embolism, right? Basically it will occur when patients are having concomitant heart failure. So these are the signs. Then sometimes you can also see these are the signs which you have to remember. ये signs कहाँ मिलेंगे? These are seen in X-ray. So these are all the X-ray signs of pulmonary embolism, right? These are signs in the X-ray. So embolism is commonly seen in bedridden patient. So patient will have history there is history of DVT, right? Then we can do duplex USG or D dimer to know the DVT or pulmonary embolism. Then they ask you, we can do a VQ scan, ventilation perfusion scan, right? Or we can perform spiral CT. But अगर मैं आपसे पूछूं what is the investigation of choice, what is the investigation of choice in pulmonary embolism? So remember, it's called CTPA. CTPA, or in simple we call this coronary. It is called computerized tomographic pulmonary angiography. So basically it's nothing, it's angio. So pulmonary embolism से बार बार एक question आता है. So understand this, what type of question? What type of question they ask you? Like a 35-year-old person is having past history of DVT, or a patient met an accident, he is bedridden from past 2 months, right? In X-ray you will see like a dilatation of pulmonary artery. You can see like a rapid clearing of contrast or Westermarck sign they can mention. Then this is the patient of, this is the case of pulmonary embolism. Very very important. Done. Okay, now moving to situs inversus bronchiectasis sinusitis. ये तो easy है. किस चीज़ का triad है? This is a triad of Carter-Gainer syndrome. Now guys, we cannot leave the easy stuffs because exam में easy चीज़ें भी आती. It is Carter-Gainer syndrome. This is Carter-Gainer syndrome. Then Carter-Gainer syndrome. Kasan Tarun, clear? Hari, Junaid, yes. Done. Okay, now tell me what it is. Flu-like symptom. What is the diagnosis? Flu-like symptom. Patient is HIV positive. India ink preparation. Severos, dextrose, agar will have smooth mucoid creamy colonies. And in treatment we give amphotericin and flucytosine. What is the diagnosis? Batao. What do you think? What is the diagnosis? क्या है? बताओ. Diagnose. They will give you like a 50-year-old person is having flu-like symptom, means fever with chills. Patient is HIV positive, like they will give you, yes, very good Tejas, it is cryptococcus. This is crypto. India ink दिया हुआ है ना, right? Done. This is cryptococcus. Very very good. Okay, अब एक मुझे एक सुबह डाउट आया था. I got a doubt from a student. Like सर हमेशा confusion होता है एंटी प्लेटलेट एंटी कोगुलेंट में. तो पहले तो मुझे लगा like initially I thought it is a very silly doubt, but then I remember when I was a student, even I used to get confused in this. So what is anti-platelet, what is anti-coagulant? Am I clear? So इस टाइप के क्वेश्चन भी एग्जाम में आते हैं. So understand this thing, and I am seeing like they are asking you questions. So first try to understand anti-platelet drug where we need to use and anti-coagulant where we need to use. Look at the screen carefully. Try to understand this. Anti-platelet means they will inhibit platelet aggregation. So worldwide the best and most common used anti-platelet drug, this is your aspirin. So aspirin is like कितने आए कितने गए हम वहीं की वहीं हैं. This is the best aspirin. Any other example you know? Any other example? P2 Y12 inhibitor. What we call that? Clopidogrel. Clopidogrel. Ticlopidin. Right? Then what we have? We have ticagrelor, cangrelor, ticagrelor. What else you will notice? You will notice we have like dipyridamole. Then very very important, यहाँ पर ही गलती होती है. Remember this apiximab. It is GP2B3 inhibitor. Tirofiban, iptifibatide. So देखो ये सारे क्या हैं? These are antiplatelets. Antiplatelets means they will inhibit platelet aggregation. Am I clear? Okay, now tell me the mechanism of action. Aspirin, how this will work? Aspirin कैसे काम करता है? तो जैसे remember minus sinus inhibition. So aspirin will inhibit COX, right? Coming to ticlopidine clopidogrel, this is P2Y12. So this will inhibit P2Y12. टिक्लोपिडिन भी सेम. टिकाग्रेलोर कांग्रेलोर ये भी सेम. दोनों में डिफरेंस क्या है, कौन बताएगा मुझे? व्हाट आर द डिफरेंस? टिकाग्रेलोर इज रिवर्सिबल and these two are irreversible. Himalayan COX-3 नहीं होता. COX-3 is paracetamol, irreversible. Now coming to dipyridamole, this is PD inhibitor. This will inhibit phosphodiesterase. F6 tirofibin, iftimaptide. These three are GP2B3A. So I am seeing a pharmacology question or a medicine question like this. They ask you antiplatelet. So these are antiplatelet. Done? Am I clear? Okay, now moving to anticoagulant. अब मुझे बताओ, टिकाग्रेलोर इज रिवर्सिबल. टिकाग्रेलोर एक और होता है कांग्रेलोर, ये रिवर्सिबल होता है, राइट? Okay, now tell me about anticoagulant. Anticoagulant and anticoagulant से बार बार एग्जाम में क्वेश्चन आ रहा है. They are asking question again and again. So what are the anticoagulants you know? पहले मुझे तुम नाम बताओ. Yes, Rakesh, very good. It is metabolic active. Anticoagulants. I have seen like this. एक silly question नहीं है. It's like an important thing. कब आपको देना है? तो देखो antiplatelet when we have to give, when we have to inhibit platelet aggregation. और anticoagulant when it's like a patient who's having high chance of thromboembolic event, like before the surgery or after the surgery. No, जुनैद, यही तो मैं गलती बचाना चाह रहा हूँ. जुनैद, अल्टीप्लेस, रेटिप्लेस, दीज आर थ्रोम्बोलाइटिक, वो अलग होते हैं, उस पर भी आएंगे अभी. विल टॉक अबाउट दैट. Antiplatelet, anticoagulant, come on. Okay, yes, first one and the best one, heparin. Now understand, heparin, when they talk about heparin, they will also talk about the types of heparin. So what are the types of heparin you know? Heparin के types होते हैं कई सारे. We have low molecular weight, high molecular weight, right? So just I am writing here. So we have heparin. Then heparin, we have different types. So let me write the low molecular weight heparin. एक तो होता है unfractionated. So what are low molecular weight heparin? Come on. We have enoxaparin, dalteparin, सारे सबके एंड में पैरिन होगा. enoxaparin, dalteparin, tinzaparin. Then what we have? We have warfarin. What else? We have? We have direct thrombin inhibitor like dabigatran. Argatroban, right? Then we have drugs like lepirodin. एक और होता है like bivaluridin. So these are what? And fourth category will be factor 10A inhibitor. Here what we have? We have rivaroxaban, ipixaban, edoxaban, betrixaban. समझ आए? Yes, unfractionated heparin is like heparin. उसको भी heparin नहीं होती. Yes, they are also ended heparin. So understand this thing. So first they ask you like these are heparins, right? So first is heparin. So heparin, what we have like this, how they will come. So we can have like unfractionated, or we can have, so even this rivaroxaban, these are also, so these are like heparin derivative. Then we have warfarin, which act on vitamin K, dabigatran, argatroban, lepirodin. ये कैसे काम करते हैं, हाउ दीज विल वर्क, एनीवन, हाउ दे विल वर्क, हाउ दीज ड्रग्स विल वर्क. These are direct thrombin inhibitor. These are direct thrombin inhibitor. Done. And this Zaban means they are banning factor 10A. 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 So these are 10A inhibitor. And these are what? These are called DTI. Direct thrombin inhibitor. Done. So देखो पहले तो यहाँ पर ये सॉर्ट हो गया एंटीप्लेटेड एंटीकोगुलेंट. नाउ कमिंग टू थ्रोम्बोलाइटिक. सो अल्टीप्लेस, रेटिप्लेस, एनिस्ट्रीप्लेस, टेनेक्टिप्लेस, दीज आर थ्रोम्बोलाइटिक. These are thrombolytic. So I repeat, understand this thing. Thrombolytic, these are drugs like alteplase, retiplase, tenecteplase, anistriptase, streptokinase, urokinase. Am I clear? So understand, whenever it is like a state MI, myocardial infarction, there is chance of MI. If we want to prevent platelet aggregation, we give antiplatelet. When it is like a state which can develop high chance of thromboembolic event, like prior to surgery, sometime like in patient with angina, in patient with unstable angina, sometime I can say in a patient with non-stimulation MI, in like atrial fibrillation. In that case, we give anticoagulant. And when there is already clot बन गया है, in that case उस clot को तोड़ना है, we need to break that. Then what we give thrombolytic. Am I clear? Am I clear? So this is something which you have to remember. Am I clear? Shubham, Rupalik. Okay, now coming to fainting plus discrepancy in atrial and ventricular heart rate. So when we see different atrial and ventricular heart rate, so understand this thing. It is called as third degree AV block. Third degree AV block, understand. In third degree AV block, what is the problem? There is AV dissociation. Means atria will move at their own pace and ventricle will move at their own pace. Am I clear? ट्रानेक्सेमिक एसिड कब देते हैं? जब ब्लीडिंग होती है. तो दैट इज कॉजिंग कोएगुलेशन. जब आपको ब्लीडिंग को रोकना है, क्लॉट बनाने के लिए. शुभम, क्लियर? Okay, now coming to asthma versus COPD, they ask you question basically on the diagnostic part. So how we diagnose? We diagnose this based on post bronchodilator FEV1. Post bronchodilator FEV1, understand, if it is more than 12% or 200 ml. देखो ब्रोंकोडायलेटर देने के बाद, राइट, in MI we can use anything. Now understand, in MI we can use alteplase, we can use better तो आजकल क्या आता है, we can use like even tenecteplase is better, right, but we can use alteplase also. मोस्ट कॉमन इंडिया में जो यूज़ होता है दैट इज स्ट्रेप्टोकाइनेस. ST क्या आता है, 1100 रुपये का आता है, सस्ता आता है, तो दैट वी यूज़ इन इंडिया. सो अंडरस्टैंड, पोस्ट ब्रोंकोडायलेटर if FEV1 increase by 12% or 200 ml, then this is a patient of asthma. If not, then remember it is COPD. तो आपको जो क्वेश्चन आएगा उसमें क्या देखना है? FEV1 वैल्यू. दैट्स इट. यू हैव टू सी FEV1 वैल्यू. Done. Okay, now coming to Cushing's, so they ask you question on causes of Cushing. Cushing's के cause पे question पूछते हैं. So what are the causes of Cushing which you have to remember? Now I will not tell you that Cushing के features सबको पता है. Central obesity, risk of diabetes, buffalo hump. Causes means Cushing most common cause. It is exogenous. Then it can occur because of pituitary tumor. Pituitary adenoma. And this adenoma is ACTH. So I just let me complete write it. ACTH secreting pituitary adenoma. It can occur because of adrenal adenoma. Then understand, then it can occur because of I can say a condition that is paraneoplastic symptom called small cell lung cancer. Small cell lung cancer. So these are some important causes. So understand this thing. Small cell को और क्या बोलते हैं? ओट cell, right? थैंक यू रूपलिक. जस्ट कीप द हसल ऑन. एग्जाम तक पढ़ते रहना है कुछ ना कुछ. Yes, it can also be in carcinoid. So just remember, most common cause will be exogenous. But they ask you sometime question, what is most common cause in elderly? Most common cause in elderly, it will be pituitary adenoma. Pituitary adenoma. Done. And coming to like investigation of choice, it will be low dose dexamethasone suppression test. Low dose dexamethasone suppression test, right? Okay, अब थोड़े से क्वेश्चन माइग्रेन पे. दे आस्क यू क्वेश्चन ऑन माइग्रेन. माइग्रेन मीन्स हेडेक. तो माइग्रेन पे क्या आपसे क्वेश्चन पूछते हैं? व्हाट डू यू थिंक? देखो आजकल जो क्वेश्चन आ रहा है, दे आर आस्किंग यू डायग्नोसिस ऑफ माइग्रेन, फर्स्ट थिंग. सेकंड थिंग, व्हाट दे आस्क यू लाइक व्हाट आर अदर हेडेक्स. Other headaches that need evaluation. तो बेसिकली ऐसे कौन सा हेडेक है जिसमें आपको आगे जाके evaluate करना है? ओके, कमिंग टू डायग्नोसिस ऑफ माइग्रेन. सुमाट्रिप्टन नहीं पूछ रहे आजकल चिकू. दे आर नॉट आस्किंग सुमाट्रिप्टन, दे आर आस्किंग यू इवन मोर देन दैट. सो हाउ वी मेक अ डायग्नोसिस ऑफ माइग्रेन? टेल मी द डायग्नोसिस, कम ऑन. कैसे डायग्नोस करोगे? सो पेशेंट विल हैव हेडेक तो हो गई. ओके, सो हाउ वी मेक अ डायग्नोसिस. ओके, आई विल गिव दोस टिप्स. फर्स्ट, टेंशन हेडेक कहाँ से आया शुभम? यहाँ पर पहले इसको ख़त्म कर लेते हैं. तो माइग्रेन को डायग्नोस कैसे करेंगे? कैसे डायग्नोस करेंगे माइग्रेन को? सर में दर्द तो है, उसके साथ साथ क्या है? सब कुछ याद है ऐसे सबको लगता है एग्जाम में. दैट इज़ द आई कैन से फीचर ऑफ अ स्टूडेंट. ये स्टूडेंट का ट्रेड का फीचर है. व्हेन आई वाज स्टूडेंट वी हैड द सेम इश्यू. So understand, in migraine you will see patient will have headache. This headache is unilateral, right? Unilateral एक तरफा होगा, and it is never mild. It is moderate to severe. Moderate to severe. Then remember this headache. This headache is pulsatile. Pulsatile. Moderate to severe. And remember, duration will be 4 hours to 72 hours. 4 hours to 72 hours. So unilateral, moderate to severe. Then this headache will have nausea or vomiting. This headache will have photophobia or phonophobia. So understand this thing. To make a diagnosis, what we need? हमें क्या चाहिए? We need any one feature from this list, any two from this list, any one from this nausea and vomiting, and any one from this. So they will give you a question like a 30-year-old female is coming to you with headache which is moderate to severe. She is having this headache from past 1 day, from 24 hours. And sometimes she is having nausea and she is having vision issues. Whenever she bright light, her intensity of headache will increase. So she preferred to sit in a dark room. So this is a diagnosis. Now coming to which headache need further evaluation. So understand this thing. Any headache that increase your ICP or IOP. ऐसा कोई सा हेडेक जो आपका इंट्राक्रेनियल प्रेशर बढ़ा दे या इंट्रा ऑक्यूलर प्रेशर बढ़ा दे. or I can say headache due to SOL. SOL meaning is space occupying lesion, means any tumor or anything that is occupying some space in your brain. Any headache that is due to some space occupying lesion. So what are these space occupying lesion? To understand this thing, headache due to any SOL, like SOL का एग्जाम्पल अगर मैं आपको बोलूँ, तो दीज आर बेसिकली कॉल्ड सेकेंडरी हेडेक. सो ऐसे कौन सा हेडेक है जहाँ पर आपको एवेल्यूएट करना पड़ेगा? तो रिमेंबर, हेडेक ड्यू टू एनी ब्रेन ट्यूमर, any brain tumor, or I can say any brain trauma like SAH, EDH, SDH, any type of hemorrhage, NCC, neurocysticercosis, CNS TB, toxoplasma, encephalitis, अभी जैसे जो बिहार में हुई थी चमकी फीवर, दैट्स अ टाइप ऑफ एंसेफलाइटिस. मेनिंजाइटिस, क्लियर? देन रिमेंबर वास्कुलाइटिस कॉल्ड टाकायास, टेम्पोरल आर्थराइटिस, टेम्पोरल आर्थराइटिस. So these are the headache which need further evaluation. Remember, these are those headache which need further evaluation. इसको आपको दोबारा evaluate करना पड़ता है. Okay, now moving to TIA. TIA means transient ischemic attack. TIA. So TIA से आपसे क्या क्वेश्चन पूछते हैं? They ask you TIA. It is nothing. It is resolution of symptoms. It is resolution of symptom in less than 24 hours. स्ट्रोक वाले सारे सिम्टम अगर 24 घंटे में ठीक हो गए, इफ़ ऑल द सिम्टम्स ऑफ स्ट्रोक दे रिजॉल्व इन 24 आवर्स, देन इट्स TIA. सो TIA, व्हाट दे आस्क यू, वी कैलकुलेट अ स्कोर. दैट स्कोर इज कॉल्ड ABCD2 स्कोर. ABCD2 स्कोर. सो व्हाट इज A? Age. B is BP. C is clinical feature. In clinical feature what we have arm weakness, मीन्स लाइक स्ट्रोक पेशेंट के एकदम से हाथ पैर में फालिश पड़ गई. स्ट्रोक पेशेंट इज हैविंग हेमीप्लीजिया, राइट? और यू कैन सी स्पीच इम्पेयरमेंट, लाइक यू कैन सी पेशेंट का मुंह टेढ़ा हो गया, ही कैन नॉट स्पीक, स्पीच इम्पेयरमेंट. सो सडन ऑनसेट आर्म वीकनेस और स्पीच इम्पेयरमेंट. D स्टैंड फॉर डायबिटीज. And D stand for duration. Diabetes duration. Duration can be 0 to 10 minutes, 10 to 59 minutes, and more than 60 minutes. So understand this thing. ABCD2 score. So अगर पेशेंट की एज 60 से ज़्यादा, if age is more than 60, then we give 1 point. If patient is hypertensive, then we give 1 point. Arm weakness, we give 2 point. Speech impairment, we give 1 point. Diabetes, we give 1 point. अगर 10 मिनट में ठीक हो गया, we give score of 0. 10 to 59 minutes, 1 point. More than 60 minutes, we give 2 points. So understand this thing. More the score, मोर इज चांस ऑफ स्ट्रोक इन फ्यूचर. जितना ज़्यादा स्कोर होगा उतना स्ट्रोक के चांस बढ़ जाएंगे. सो व्हाट इज़ द पॉइंट ऑफ दिस स्ट्रोक, पॉइंट ऑफ दिस स्कोर? सो दिस स्कोर, अंडरस्टैंड दिस ABCD2 स्कोर, दिस विल प्रिडिक्ट फ्यूचर रिस्क ऑफ स्ट्रोक. इट विल प्रिडिक्ट फ्यूचर रिस्क ऑफ स्ट्रोक. क्लियर? एम आई क्लियर? Am I clear guys? समझ आ गया? Done? So this is very very important. They ask you question on ABCD2 score. Kasan Tarun Ruplik, clear? Any doubt in this? Okay, now they ask you question on pneumonia treatment. अब आपसे question pneumonia के treatment से पूछते हैं. So understand this thing. Yes, more the score, more will be chance of stroke in future. अब न्यूमोनिया के किस टाइप का क्वेश्चन आता है, देखो इसको समझो. What type of question they ask you in exam? They ask you like in pneumonia how you will treat this. So for this also we need to calculate curve 65 score. कर्व 65 स्कोर. तो पहले तो आपको कर्व 65 स्कोर कैलकुलेट करना है. अब देखो कर्व 65 स्कोर क्या होता है, एनीवन कौन बताएगा मुझे? कम ऑन. C4 कंफ्यूजन, U4 यूरिया नाइट्रोजन मीन्स BUN, R for respiratory rate, this is more than 30, B for BP less than 90 by 60 means patient is having hypotension. Then understand, then what we have 65 is age of patient. यहाँ पर सबको एक पॉइंट देना. We give 1 point to every case. Done. Now tell me what is the benefit of this score? Score का फायदा क्या है? Anyone? कौन बताएगा? Now see, if you see score value like 0 to 1, or if you see score value 0, suppose अगर score value 0 है, then it is a patient which we need to just write the medicine and send the patient to home. OPD में आप इसको छुट्टी कर दो. Clear? If score value is 1 to 2, then this patient need to be admitted in IPD, and if it is more than 2, इसको भी आपको IPD में admit कहाँ करना है? ICU में. This patient you will admit in non-ICU. Non-ICU means you can admit in normal ward. Done? Now try to understand this thing. They ask you management. अब आपको treatment करना है. So treatment कैसे करोगे? How you will treat this? बताओ how you will treat. शुभम बताओ कैसे ठीक करोगे? How you will treat, what you will decide. कौन सी एंटीबायोटिक स्टार्ट करनी है, कौन सी स्टार्ट नहीं करनी. What antibiotic will start like empirically. Come on. कैसे आप स्टार्ट करोगे? Suppose you have calculated this. Now we need to see the patient. अब आपको पेशेंट को देखना है. So let's say I'll divide my patient into two categories. So suppose I can say patient is healthy, or I can say young patient. हेल्दी यंग का उल्टा क्या होगा? ओल्ड पेशेंट. और अनहेल्दी पेशेंट. अनहेल्दी मीन्स सम कार्डियोवास्कुलर डिसीज. He or she is having some cardiovascular disease, right? Now understand this thing. Suppose this patient is having, suppose there is a healthy patient. In this case, young patient, what you will choose? In simple language, I can say healthy means no comorbidity. Here you can see comorbidities are there. अब इसको देखो. So if it is a healthy patient, what do we give? We give azithromycin or we can choose any beta lactams. इसमें क्या करोगे? Suppose if it is unhealthy, comorbidities are there, then you will add both, means it is azithro plus beta lactams. Simple. So the difference is either or, right? Now understand this thing. Or alternative will be respiratory fluoroquinolone, means we can use moxifloxacin. So मेरे कहने का सिंपल सा मतलब है, पेशेंट अगर यंग है, if patient is young, if patient is young, so remember, if patient is young, in that case what we choose? We can use one antibiotic. In case of sick patient, give two. Done? Okay, now moving to OHS. OHS means it is obesity hypoventilation syndrome. So this you need to differentiate with OSA, obstructive sleep apnea. अब इसको देखो, दोनों में क्या डिफरेंस होता है? There are certain differences in these two conditions. First is, here patient is mostly obese. Patient ज़्यादातर मोटा होगा. नाम में obesity, here it is always obese. Patient will be always obese. Clear? Okay, now moving to OSA, obstructive sleep apnea. Understand? In this case, you can notice PaCO2 of the patient. It is normal unless patient is in unless patient going into respiratory failure. देखो respiratory failure, whenever patient will land up in respiratory failure, then of course PaCO2 will increase. But here remember, here PaCO2 is on a higher side. So मेरे कहने का क्या मतलब है, respiratory acidosis में रहेगा ये patient. And obesity means, of course, obesity means BMI will be more, right? Obesity means BMI will be more. So try to understand this type of clinical case they ask in exam again and again. तो देखना है क्वेश्चन को आपको ध्यान से, दो चीज़ें फोकस करनी है. And the very important thing is, if patient is in respiratory acidosis, PaCO2 is more, then it is obesity hypoventilation syndrome. Very important. Done? Obesity hypoventilation syndrome. Am I clear? Is it clear? Any doubt, guys? Done? Ruplik, Shubham. Okay, now coming to rheumatic heart disease. Rheumatic heart disease. So what they ask you question in exam, they ask you question basically on Jones criteria. Jones criteria means J for joint inflammation. Joint inflammation, this inflammation will move from one joint to another joint, so we call this migratory polyarthritis. Migratory polyarthritis. O for, of course, heart. Of course, heart means it is, of course, pancreatitis. In heart it will cause pancreatitis. N for nodules. These nodules are subcutaneous. E for erythema nodosum. With S we have two things. With S we have Sydenham chorea. And with S what we have? We have subclinical carditis. Done? Now understand, this is what, this is जो मैंने आपको लिखा है Jones, JONES. These are the major criteria. These are the major criteria. Now coming to minor. Coming to minor, what we have, understand, arthralgia. Arthralgia means joint pain is minor. देखो joint inflammation is major. Increase in PR interval in ECG, increase in C reactive protein, increase in ESR, and नाम में fever है, but fever is minor. So these are minor. So generally exam what they ask you, all are major except, all are minor except. So this is about your rheumatic heart disease. Rheumatic heart disease. Then they ask you few pathology question here. Pathology question क्या पूछते हैं? They ask you, you will find ash of bodies. Ash of bodies. These ash of bodies are made up of fibrinoid necrosis. Then what else they ask you? They ask you like patient will have McCallum patch. McCallum patch you will see where? In left atrium. Then patient will have bread and butter pericarditis. Bread and butter pericarditis. Dystrophic calcification. Dystrophic calcification. Okay, one more thing they ask you, like rheumatic chorea is a last finding. So they ask you treatment. So In treatment, understand, we will use for prophylaxis what we give benzathine penicillin. Alternative to this will be azithromycin. Then we have to use aspirin. Now they ask you chorea. Pancarditis means it could be pericarditis, myocarditis, endocarditis. Chorea में क्या देते हैं? Understand, for chorea what we give? We give valproate. There is no improvement from valproate. Then what we start? We start haloperidol. And ultimately, if this also fail, then we give IVIG. So this is the management of chorea. So अब आपसे क्वेश्चन पूछते हैं, ड्रग ऑफ चॉइस इन कोरिया. द आंसर इज valproate. But in refractory cases, in refractory chorea, what we give? We give IVIG. This is about your rheumatic fever. Done. Okay guys, let's take a short break. It's 4:37. We'll start after, means 15 मिनट में स्टार्ट करते हैं. तो come back in 15 minutes. We'll start in 15 minutes. Have a cup of tea and come back. Okay guys, I'm audible. So can we resume? Okay, now they ask you question on Duke's criteria. So Duke's criteria, understand this is done for infective endocarditis and which is also called as SABE. SABE, or you can call this as subacute bacterial endocarditis or infective endocarditis. Infective endocarditis. Now understand, to make a diagnosis, what we need three sets of blood culture, one aerobic, two anaerobic with a gap of 30 minutes. एक तो यही क्वेश्चन आता है एग्जाम में, इज द नीट पीजी क्वेश्चन. Now understand, they ask you question like what are major criteria, what are minor criteria. So understand this thing here. Major criteria include either microbiological evidence, means either positive blood culture or echo finding, or you can see positive echo finding. So understand this thing, either radiographical evidence or microbiological evidence. Then all others will be minor. And they ask you question like what we have in minor. So in minor criteria, what we have, again here also fever will be minor. Any predisposition condition. So what is the meaning of predisposing condition? Understand, predisposing condition means suppose patient पहले से कोई IV drug ले रहा है, so patient might be taking some IV drug, or I can say this patient is I can say a patient who is having some dental extraction, so that is called predisposing condition. Predisposing event, so this will be minor. Then remember some vascular phenomena, immunological phenomena, and microbiological evidence is not in above mentioned culture. So you can see fever, predisposing events, vascular phenomena like any arterial embolization, or I can say patients having any type of hemorrhage, conjunctival hemorrhage, JNV lesion, splinter hemorrhage. Then remember Roth spot, Osler node, these are immunological evidence, and any culture which is not in the major. Then they ask you question on celiac sprue. Celiac sprue से तो एग्जाम में बार बार क्वेश्चन आता है. So just remember what is the name of HLA. HLA is DQ2, DQ8. Celiac sprue is hypersensitivity to bro. Bro means barley, rye, oat, wheat. These are called as gluten. These are called gluten containing cereals. तो जो आपको याद रखना है, R is rye. R is not rice. So barley, rye, oat, wheat. Barley, rye, oat, wheat. Okay, now tell me about celiac sprue. How you'll make a diagnosis? आप diagnose कैसे बनाओगे celiac का? What is the investigation of choice? So remember, investigation of choice will be small intestinal biopsy. And in biopsy, what you will find? You will find क्या मिलेगा biopsy में? Anyone? What you will find in biopsy? You will find villus atrophy. And crypt hyperplasia. Villus atrophy and crypt hyperplasia. And very very important, this is associated with dermatitis herpetiformis, type 1 diabetes, Down syndrome, Hashimoto's. So these are some association which you have to remember. Celiac sprue. Okay, let's now talk about some valvular heart disease. Now what type of question they ask you from valvular heart disease? DQ2, DQ8. Okay, DQ2, DQ8. Done. So you will see diastolic murmur, Austin Flint murmur. Then remember, you can see the causes can be bicuspid aortic valve, SABE, rheumatic heart disease. These are the causes. So then these are some sign like De Muset sign, Muller sign, thumb sign, Corrigan's pulse or water hammer pulse, right? Coincase sign. Then we have Traube sign, Drosius sign, Gerhardt sign. I take NEET PG session as well. Now like exam is nearby for FMG, so there are more session on FMG basis. Maybe like in next month when NEET PG exam will be near, then I'll take more session of NEET PG. Gerhardt sign, Rosenberg. So these are the named signs which you have to remember. And remember this intra-aortic balloon pulsation, beta blocker, these are contraindicated in acute AR. Treatment will be aortic valve repair. Tricuspid regurgitation, remember most common cause will be annulus dilatation. And you will find here CV waveform. CV waveform को क्या बोलते हैं? LNCC sign. And you can see pansystolic murmur which will increase with inspiration. We call this Carvalho sign. It is called as Carvalho sign. So these are all the MCQs on TR. Okay, now this is something which is a pathomedicine overlap thing called amyloid. So आपको exam में question पूछते हैं, they ask you like which type of amyloid you will see in which condition. So what are the types of amyloid you know? What are the types of amyloid you know? Anyone? So we have AL amyloid, AA amyloid, A beta amyloid, A beta 2M amyloid, ATTR amyloid, A Cal amyloid, IAPP amyloid, IAPP also called as amylin. So these are the different types of amyloid. Now coming to AL amyloid, understand? AL amyloid is also called as primary amyloid. So this is something which we see in multiple myeloma. AA means amyloid associated. It is called as amyloid associated, means we see this, we call this secondary amyloid. It is seen in chronic inflammation. Chronic inflammation. अब मुझे बताओ, all chronic inflammation will have secondary amyloid except one. Except one chronic inflammation that will not have amyloid. Anyone? Gunavartini, Zunaid. Which chronic inflammation will not have? It is chronic bronchitis. Chronic bronchitis will not have. Now coming to A beta, it is called as CNS amyloid. This is something which we see in Alzheimer disease. CV waveform means देखो CV आपस में fuse हो जाएगा. So what we see, C is a positive wave, then ACV, these are the JVP waves. A wave, C wave, V wave. So C, V will fuse together. एक जैसा दिखेगा. We call it CV waveform. A beta 2M, understand? This is also called as dialysis associated amyloid or renal amyloid. ATTR, TR means transthyretin. Transthyretin. So this is amyloid that we see in heart. In heart, especially where restrictive cardiomyopathy. Okay, I'll explain that. ACAL. ACAL means calcitonin. This is seen in MTC. ये last year NEET PG में आया था, INICET में आया था. ACAL. Then IAPP or amylin. This is called amyloid of your pancreas. Right? Now just remember few fact about amyloid. That fact will be, first thing is amyloid is extracellular protein. It is not intra, it is extracellular. And there is no treatment for this. Right? And what they ask you, you will find apple green by references under polarized light. So these are the types of amyloid which you have to remember. Okay, just remember, this is not important for FMG but important for NEET PG. ATTR amyloid you will see in 2 familial syndrome. So ATTR amyloid you will see in 2 familial syndrome. First is called senile systemic amyloidosis. We call this as senile systemic amyloidosis. And second one will be familial amyloidotic. Senile systemic amyloidosis, and second one will be familial amyloidotic polyneuropathy. familial amyloidotic polyneuropathy. This is something which you have to remember. Okay, now moving to renal function. तो देखो GFR or how we can measure GFR by creatine, by inulin, then we can have an equation called MDRD. MDRD equation means if you see any KFT report these days, kidney function test reports, then they have calculated GFR from MDRD, means modification of diet in renal disease. Then we have EPI cystatin C method. This is currently the best method for GFR, and there is an old formula. This old formula is called as Cockcroft-Gault formula. Cockcroft-Gault formula. So these are the method to calculate GFR. So just let me do the numbering part. 1, 2, 3, 4, 5. For tubular function, we will do water deprivation test. For plasma flow, we have para-aminohippuric acid. So these are the MCQ that they ask in exam. Done? Junaid, am I clear? Any doubt, guys? Done? आगे चलें. Okay, now understand this thing. They ask you a question on Parkinson disease and Huntington disease. How we can differentiate? So in Parkinson, what they will mention, remember, in Huntington disease, we gave a drug. कौन सा ड्रग देते, कौन बताएगा मुझे? Kasan, Tarun, Junaid, Rabani. Try to answer which drug we gave in Parkinson and which drug we gave in Huntington. Okay, tell me the answer then. So in Huntington, we have a drug called tetrabenazine. And just remember that this drug, tetrabenazine, this drug, it is actually drug of choice in Huntington disease, but this can cause Parkinson. So first thing is clear, tetrabenazine can cause Parkinson. So Parkinson disease will have typical classical features. These features are tremors, rigidity, akinesia, and postural instability. So we have tremor, rigidity, akinesia, and postural instability. Postural instability. In Huntington disease, you will see it is due to CAG repeat. CAG repeat at chromosome 4. Yes, tetrabenazine can cause Parkinson. Done? So Huntington disease. Okay, now moving to pneumoconiosis. अब pneumoconiosis भी एक important topic है. So mostly in exam what they ask you, ज़्यादातर question किससे पूछते हैं? They ask you question on most common pneumoconiosis, that is silicosis. So what are the MCQ they ask you? They ask you question on particular factory, silicosis. Yes, Hunt in cage, asbestosis, coal worker pneumoconiosis, berylliosis, bacinosis, bagasosis. So these are the various types of pneumoconiosis. Yes, syndopa is levodopa plus carbidopa. Okay, now coming to silicosis. Silicosis means, तो आपको याद कर रखना फैक्ट्री का नाम. Silicosis means, so factory generally you will see it is seen in mines. Asbestosis, cement, shipyard. So these are the common factory. Coal worker, coal mines. Coal mines. So factory name is clear. Berylliosis, aerospace industry. Aerospace industry. Bacinosis, cotton. Bagasosis. Bagasosis is sugar mills, or I can say the wastage of sugar cane is called bagash or molas, means it is used to produce paper or cardboard. Paper or cardboard. Okay, now coming to silicosis. Silicosis, what else they ask you? So we have different form of silica. So we have different form. So remember, most dangerous form will be crystalline silica. Crystalline silica. Silica will have a classical pattern on CT. कोई बताएगा मुझे? Any classical pattern on CT? We call this crazy pavement pattern. In CT scan. Asbestosis, understand here most dangerous form will be amphibole. Amphibole. And here you will see some, sometime, not always, but sometime you will see some pattern on X-ray. Eggshell calcification you can also see. Eggshell you will see in X-ray. But remember, eggshell is not specific. Shubham, clear beta? Eggshell specific नहीं होता. Eggshell you will also see in many other conditions. In asbestosis you will see in X-ray holy leaf sign. Holy leaf sign, then shaggy hurt border. Shaggy hurt border. So these are the findings which we see in X-ray. In coal worker pneumoconiosis, remember it is something which is associated with rheumatoid arthritis. And when it is associated with rheumatoid arthritis, इसको क्या बोलते हैं? We call this Kaplan syndrome. Kaplan syndrome. Berylliosis, understand. For this, what we do beryllium lymphocyte proliferation test. Beryllium lymphocyte proliferation test. Byssinosis, it is also called as Monday lung syndrome or Monday lung disease. Right? So these are some of the MCQs which you have to remember from different type of pneumoconiosis, and very very important. अगर मैं आपसे पूछूं, most common is silicosis. Very very important. Silicosis is dangerous, understand, because it will lead to macrophage dysfunction. So there is increased risk of tuberculosis. And asbestos, understand, asbestos will increase risk of cancer. Asbestos will increase risk of cancer, and remember, most common will be bronchogenic adenocarcinoma. But in exam what they ask you, most specific will be mesothelioma. So this is about your pneumoconiosis. Done. Okay, now you can see what we can see. क्या finding आपको दिख रही है? So this is, suppose I can tell you, this is the patient of CKD. ये CKD का patient है. It's a patient of CKD. So what you can see in this image, you can see a soft tissue swelling. This soft tissue swelling is called as tumoral calcinosis. Tumoral calcinosis. And you can see half of the nail will be white, half will be, जो हमारे नाखून के पास ल्यूनुला होता है, तो आधा nail, half nail will be pink, half will be white. So what we call this half and half nail. Half and half nail. And what it is, ये क्या है? Anyone, कौन बताएगा मुझे? This question came in UPSC CMS exam, expected in FMG and NEET PG. UPSC CMS में आ चुका है. It is not SCHAR. You can see there is a necrosis inside, एक necrotic core है अंदर. It is whenever you will give warfarin to patient, then what we call this? Because of warfarin, patient can develop, yes, snowstorm appearance you will see in silicosis. Very good, Tawhid. Then what we call this calciphylaxis. Calciphylaxis. Done. So this is about your tumoral calcinosis. Half and half nail, and these are seen in CKD patient. Okay, now coming to brain hemorrhage. So what are the types of brain hemorrhage? You know, कौन से type के brain hemorrhage आपको पता है? So for this, just I'll try to make a drawing. Suppose these are the dura layers. So we have, this is dura matter. This is arachnoid matter. This is pia matter. Right? Now understand, above the dura we have arteries. So these arteries are called middle meningeal artery. Below the dura, understand, here what we have plexus of vein. This plexus of vein, we call them vortex vein. Vortex vein, or you can say emissary vein. Vortex vein, emissary vein, or we call them bridging vein. And here understand, here you can see a circle. This is the circle what we call them circle of Willis. Circle of Willis. Now try to understand this thing. Suppose if there is any hemorrhage above the dura, we call this epidural hemorrhage. So epidural hemorrhage will occur because of rupture of which artery? MMA. Below the dura, अगर bleeding यहाँ पर होगी, so what we call this? We call this SDH, and SDH will occur because of rupture of vortex vein. And if this is rupturing, understand, it will cause SAH. So SAH will occur when there is rupture of circle of Willis. This circle of Willis will have small aneurysm. You will see formation of small or micro aneurysm here. These small aneurysm are these aneurysm will rupture. So what we call them? We call them Berry's aneurysm. And understand, in subarachnoid space, what else we have? We have CSF. We have CSF. So now you can see the CSF. This CSF is called xanthochromic CSF. Xanthochromic CSF. Now let's see the MCQ. What type of MCQ they ask you in exam? Look at the screen. They ask you epidural hemorrhage. It is due to rupture of middle meningeal artery. We also call this Stock and Dye syndrome. Means patient may be normal for a few time. So there is like a period of where patient become absolutely normal. क्या बोलते हैं इस period को? What we call this period? A period where patient will become absolutely normal. He will talk normal, then next day or maybe next day he will die. Stock and Dye syndrome. Rabani, what we call this? What we call this? Now see, epidural hemorrhage, middle meningeal artery, subdural vortex vein. Yes, we call this very good lucid interval. This interval means जहाँ पर patient बिल्कुल normal हो जाएगा. What we call this? We call this lucid interval. Done? Now understand. Look at the screen. Suppose if it is a Berry aneurysm rupture, it will cause xanthochromic CSF. means CSF का color थोड़ा कैसा हो जाएगा? It will be like a tan color CSF. And here patient will have worst headache of his life. So patient will tell you, I am having worst headache. इतना सर दर्द मुझे कभी भी नहीं हुआ. That type of headache is called as thunderclap headache. Thunderclap headache. Okay, now coming to this, in these two hemorrhage, what we have to do? You have to stop the bleed. When you have to stop the bleed, so we need to evacuate the hematoma. Hematoma को evacuate करना. So what we do? We can do a surgery. That surgery is called as burr hole surgery. If there is no improvement coming from burr hole, then next option will be hemicraniectomy. Hemicraniectomy. Clear? But in subarachnoid hemorrhage, understand here, this is the aneurysm creating problem. This aneurysm is creating problem, so we need to clip this aneurysm, right? So here how you will manage? So treatment will be by clipping of this aneurysm. Clipping or coiling of aneurysm. Just one more thing they can ask you, this is expected question. We have a scale called Hess and Hunt scale. We have a scale called Hess and Hunt scale. And remember, this Hess and Hunt scale is done. Hess and Hunt scale we do for SH. This is done for SH. Done? So this is about your brain hemorrhage. Okay, pheochromocytoma से बार बार question आता है and they ask you question on the investigation part. So basically they ask you question on the investigation part. So So how you will know about the investigation part? कैसे याद रखना है आपको? So understand what are the investigation which you have to remember. कौन बताएगा मुझे? Anyone? So they ask you total 5 to 6 investigation. So what we do for screening, that is an MCQ. Then understand what we do for confirmation. 10% bilateral, 10% familial, 10% pre-malignant. शुभम कंफ्यूज नहीं करना, MMA था B12 में, यहाँ VMA होता है. Then what is the radiological test we do? And what we do if it is too small or if it is extra adrenal. Now understand, first one, for screening the best test will be urinary metanephritis. Urinary metanephritis. We can also check VMA level, but remember VMA is more specific. VMA is more specific for neuroblastoma. For confirmation, we will do plasma metanephritis. For confirmation, what we have plasma metanephritis. Radiological investigation, so we can do CT और we can do MRI abdomen और CT abdomen. अगर दोनों में से एक चूज करना है तो remember MRI is slightly better than CT. If it is too small or extra adrenal को क्या बोलते हैं? Extra adrenal is also called as paraganglioma. Extra adrenal is also called as paraganglioma. So when it is extra adrenal paraganglioma, in this case, what we do? In this case, like now see, previously अगर आप देखोगे of your exam, then they will give you MIBG scan. But what Harrison says, DOTA TAT scan is better than MIBG scan. So these are the investigation जो बार बार exam में आते हैं. Very very important. Very very important. Okay, now coming to lung cancer. In lung, they ask you question generally from two things: squamous cell carcinoma and oat cell carcinoma. अब दोनों को कैसे differentiate करेंगे देखो. Squamous cell carcinoma and oat cell. Oat cell means small cell, right? Okay, now coming to squamous cell carcinoma. So here everything you can remember by a mnemonic C. And here everything you can remember by a mnemonic A. Simple. बस इतना सा पढ़ना है. So understand this thing, everything with C, everything with A. So what we have with C? This is something which is commonest in males, commonest in India, and commonest in smokers. So first C is done. C4, this is something which is centrally means ये lung के बीच में होता है. Third C, understand, it will look like a cavity. So sometime it will look like a cavity, right? Cavity, co-infection, super infection, HIV, hepatitis B का. Okay, I'll explain this. Cavity. Then remember C4, calcium increase. Calcium increase means hypercalcemia, and this hypercalcemia, it occurred because of parathyroid hormone related peptide, PTHRP. C4, clubbing. Clubbing means club जाना नहीं है. Clubbing means nail clubbing. Patient will have grade 4 clubbing. Grade 4 clubbing is called as hypertrophic osteoarthropathy. Grade 4 clubbing. Clear? So commonest in India, commonest in males, and biopsy. अगर आप biopsy करोगे, in biopsy what you will find? You will find keratin pulse. So keratin, I am not finding this good, so I am adding a word cyto before keratin. Cytokeratin pulse. Simple. cytokeratin pulse. So you can notice all the C. Done. Now coming to A, small cell. Small cell, here everything will start with A. So what we have in our A, in A list, first A is a little. A little means ये छोटा सा है, छोटू है, छोटा पैकेट बड़ा धमाल. A for a little, A for aggressive. Aggressive means it is most dangerous. Then third A, understand, it is also centrally. ये भी सेंटर में होता है. Then remember it occurred due to amplification of a gene. Which gene? Amplification of LMYC gene. LMYC gene. Then remember this next A. Here you will see ACTH will increase. When ACTH will increase, it means patient will develop Cushing. Next A, remember ADH will increase. ADH will increase means patient will develop SIADH. Next A, understand, patient will develop antibodies. Which antibodies? Antibodies against PQ type of calcium channel. PQ type of calcium channel. And this is what we call, इसको बोलते हैं Lambert-Eaton syndrome. Lambert-Eaton syndrome. And last, I understand, in biopsy you will find azopardy effect. So you can see all here, you can remember by mnemonic A. Simple. Now understand this thing, something I am highlighting here, this hypercalcemia, Cushing, SIADH, Lambert-Eaton, these are called paraneoplastic symptom. These are called paraneoplastic symptom. Am I clear? Paraneoplastic symptom. Is it clear? Done? Paraneoplastic symptom. Any doubt on this? So it's very very important guys, which you have to remember. This is something which is extremely important, which they ask in exam. ये बार बार exam में पूछते हैं. It's very very important. Okay, now moving to cystic fibrosis. From cystic fibrosis, just remember what they ask you. They ask you it is due to CFTR gene mutation at chromosome 7. At chromosome 7. Then understand this thing, it's a disease, we also call this salty baby syndrome. Salty baby syndrome. For management, what we give N-acetylcysteine, and we have a new drug. That new drug is called Ivacaftor. Patient को problem क्या होगी? What is the problem? Patient will have, there is risk of Pseudomonas infection. Pseudomonas infection, right? Yes, it's the chloride channel defect. Chloride channel defect. It's the defect of chloride channel. Okay, now moving to heart failure. So they asking you question from heart failure drug. Congratulations, you pass your exam. Now keep the hustle on. PG करनी है, उसके बाद ही घर जाना है. PG करनी है. PG is must. Now coming to heart failure. Now understand, they ask you in acute heart failure what we give. In acute heart failure, understand what we give. अगर patient को acute heart failure है, in this case you have to save patient life. You have to save patient. So how we can save patient life? So we will give inotropes and we will use diuretics. But in exam what they ask you chronic heart failure. Chronic heart failure. So what are the possible options in chronic heart failure? So we will give beta blocker, a must. Then we can choose ARNI. ARNI means sacubitril valsartan combination. ARNIs are a bit expensive, so we can try ACE inhibitor or we can use ARBs, ACE inhibitor, ARBs, any one from this. Then we can choose spironolactone or any other diuretics in low dose, except thiazide we don't use. और बताओ क्या देते हैं? What else? We can use suppose ivabradine. Ivabradine, it is like funny current channel inhibitor. Ivabradine, it act on funny current. What else? और क्या देते हैं? In chronic heart failure, what else we can use? We can use vitamin. Which vitamin? B1, thiamine. Then we can choose omega-3 fatty acid. Okay, now tell me, remember SGLT2 inhibitor, this canagliflozin, dapagliflozin, these are also approved for heart failure even in non-diabetic patient. Then we have a new monoclonal antibody, canakinumab. This is something which you should know about heart failure. Just remember, I am highlighting something: beta blocker, ARNI, ACE, ARB, SGLT2 inhibitor. These are the drugs which will have mortality benefit. Mortality benefit means they will save patient. So they will have mortality benefit. These are the drugs which will have mortality benefit. Okay, now moving to pancreatic tumors. Pancreatic tumors, अब इसको देखो यहाँ से क्या क्वेश्चन पूछते हैं. So they can ask you different pancreatic tumors. So let's say we have insulinoma, then what we have glucagonoma. अभी तो ब्रेक लिया था. You can take the break, you can come back. This video will be in the YouTube, don't worry. Then we have VIPoma. And the fourth important will be gastrinoma. So understand this thing. In exam, what they ask you like, first, what is the investigation of choice? So in all these tumor, remember, in all these tumor, investigation of choice is same. That is called EUS. EUS means endoscopic ultrasound. Endoscopic ultrasound, endoscopic sonography. Now understand, insulinoma में आपको क्या याद रखना है? You have to remember this will something, it will present with a triad. कौन सा triad होता है? Insulinoma is more insulin means glucose will be less. So patient will have recurrent hypoglycemia. What is the triad? Whipple's triad. Glucagonoma means more sugar, more glucagon means more glucose. So here patient will have hyperglycemia. Hyperglycemia means this patient will be diabetic. This patient will be diabetic. And remember, this patient is something. This is something associated with a type of skin lesion. This is called necrolytic migratory erythema. So this is like a type of rash you will see. Now understand, VIPoma. VIPoma is the one which is associated with watery diarrhea. So we call this WDHA syndrome, WADA syndrome. WADA meaning is patient will have watery diarrhea, hypokalemia, achlorhydria, achlorhydria. And gastrinoma, understand, gastrinoma is the thing like where patient will have multiple refractory peptic ulcers. So in gastrinoma you will see refractory peptic ulcers. So this is something which they can ask you as a clinical case, right? Okay, moving to multiple myeloma. Multiple myeloma कैसे diagnose करते हैं? How we make a diagnosis? So remember, it is how we make a diagnosis. You will see clonal plasma cells. Clonal plasma cells, these are more than 10%. Or biopsy proven. Or you can see biopsy proven plasmacytoma. Biopsy proven refractory epilepsis नहीं, refractory peptic ulcer disease. So biopsy proven plasmacytoma means biopsy proven plasma cell tumor. Plus you will see crab feature. Crab means hypercalcemia. R for renal involvement, A for anemia, and B for bony lytic lesion. Bony lytic lesion. Done. This is about multiple myeloma. Clear? Okay, now see Gilbert syndrome का question कैसे आता है? What type of question they ask you from Gilbert syndrome? What type of question they ask you on Gilbert syndrome? What type of question they ask you? So understand Gilbert syndrome, they ask you a question like it's a patient, it's not a child, it is an adult. So they will ask you it's an adult. Right? In this adult, it is generally, remember, an incidental finding. It is something which is incidental finding. So patient will have, कौन सा bilirubin बढ़ेगा यहाँ पे? Unconjugated, conjugated. Increase in unconjugated bilirubin. And remember, remaining things will be normal. Remaining enzymes will be normal. Remaining enzymes will be normal. Clear? So this is like a 28-year-old. मेरे पास एक पेशेंट भी आया था 28 ईयर का. Like they will give you 28-year-old or 30-year-old persons coming to you with increase in unconjugated bilirubin. However, SGOT, SGPT, alkaline phosphatase, these enzymes seems to be normal. So that's the case of Gilbert syndrome. Okay, now they're asking you question on heat stroke. I have seen few question on heat stroke. So understand this thing again. They will give you like a worker working in dry, hot weather is having cramp, confusion, dizziness, tachycardia, acidotic breathing. So this is called heat stroke. And remember, the key feature to make a diagnosis, what you should remember, here you will see sweating is absent. Sweating is absent in heat stroke. Clear? So it occurs due to loss of thermoregulatory mechanism. So they will give you a clinical case, and remember, heat stroke में क्या absent होगी, sweating will be absent. Clinical case again. Okay, now we have GBS, Guillain-Barré syndrome. So GBS, we have I can say two variety of this. So we can have acute type and we have chronic type. In acute we have again 4 varieties. So most common type you will see in acute, it is called AIDP, acute inflammatory demyelinating polyneuropathy. Second type will be Aman, acute motor axonal neuropathy, acute motor sensory axonal neuropathy, AMSAN. And fourth is called Miller-Fisher. So Miller-Fisher. So these are 4 acute variety. In chronic, what we have only one type, that's called CIDP. Yes, it is ascending paralysis. Now try to understand this. अब इसको समझो एक बार. If you see, this is acute type AIDP. So Aman AMSANs are almost the same. In these 2 varieties, understand, you will find an antibody. This antibody will be anti-GD1A. In Miller-Fisher, understand, you will find GQ1B. and in AIDP you will find GM1. Chronic will not have any specific antibody. Now understand these all antibodies. These antibodies, they ask you, these antibodies are of IgG type. And very very important, patient will have history of gastroenteritis. So they will give you like patient have consumed burger outside. So this gastroenteritis occur because of Campylobacter jejuni. So patient ने बाहर खाना खाया, so Campylobacter infection. Then understand this is like in a span of like I can say 2 to 8 weeks. In case of acute, patient develop ascending neuropathy. अब मुझ देखो कैसा क्वेश्चन पूछेंगे ना, अंडरस्टैंड दिस थिंग. A 50-year-old person had for fried rice outside or burger or pizza outside. Later on, after 2 weeks, he developed weakness which started from lower limb, then it moved upward. So this is the case of GBS. Okay, GBS से और क्या क्वेश्चन पूछते हैं, अंडरस्टैंड, वेरी वेरी इंपॉर्टेंट. They ask you, you will find something in CSF. In CSF, you will see cells will be normal. Only protein increase. Generally क्या होता है, अगर if you find any problem, then remember cells and protein both will increase. So it is called as albuminocytological dissociation. Albuminocytological dissociation. Albuminocytological dissociation. Then okay, now they ask you question on insulin. So we have different types of insulin. So just remember insulin के types होते हैं. So we can have short acting insulin, we have intermediate acting insulin, we have long acting insulin. So understand the short acting, intermediate, long acting insulin. The short acting means the duration of action is short. So here what we have Lispro, Aspart, and glulysin. Lispro, Aspart, glulysin. Intermediate we have NPH. NPH is neutral protamine hagedrone and regular insulin. In long what we have glargine. Then we have degludec, and detemer. Okay, coming to Afreza. Okay, Afreza पे आते हैं. So we have Afreza and Exubera. Afreza and Exubera, these are two inhalational insulin. These are two inhalational means ये powder form में आते हैं. But again, nobody will ask you these insulin. What they ask you short acting, long acting. ऊपर देखो ध्यान से, look at the screen carefully. Short is having S, Lisprom S, Aspart is having S, glulysin is having S. अगर आप ध्यान से देखोगे, listen carefully, there is no S anywhere. You can see there is no S here, no S here. Large means large or long, these are synonym. Large and long, these are synonym. So long और large. So glargine के अंदर क्या है, LARGE. And what is long? Long is distance. Longest distance. So D for distance, D for degludec, D for detemer. Simple. So they ask you all are short acting except, all are long acting except. So this is about your different types of insulin. Done. Different types of insulin. Am I clear? Okay, then these are some important topics which you have to remember. देखो रेनॉल्ड से बार बार क्वेश्चन आता है तो रेनॉल्ड आपको पढ़ना है. ग्रेव डिसीज दे आस्क यू क्वेश्चन इन एग्जाम. जस्ट रिमेंबर इट्स टाइप 5 हाइपर सेंसिटिविटी. Then in your pathology copy or textbook you can see a table of hypersensitivity. So there is always one question on hypersensitivity which they ask in exam. Even I have prepared a list of topics which are important. Most of them I have covered. Then vasculitis they ask you in exam. We have like different types of vasculitis, like we have Chapel classification: large vessel, medium vessel, small vessel. Then very important is glass glaucoma scale. Clear? SLE से क्वेश्चन पूछते हैं एंटीबॉडी का, तो SLE के एंटीबॉडी एक बार सारी पढ़ लेते हैं. तो व्हाट एंटीबॉडी वी हैव टू रिमेंबर? आना, एंटी DSDNA, एंटी स्मिथ, एंटी रो, एंटी bodies against RBC, antibodies against platelet, anti-histone, anti-neuronal antibody. We also call this anti-glutamate antibody, anti-ribosomal P antibody. So understand. Now coming to first one is ANA. ANA है तो SLE है. So SLE, ANA means this is most sensitive antibody. Anti-Smith is most specific. Anti-DSDNA is specific and it is having prognostic value. बट अगर मैं आपसे पूछूं मोस्ट स्पेसिफिक, इट इज एंटी स्मिथ. एंटी रो यू विल सी इन नियोनेटल SLE. एंटी RBCs, एंटी प्लेट. एंटी RBCs will cause anemia, means SLE patient can develop AIHA. SLE patient can develop ITP, immune thrombocytopenia purpura. Drug induce, for drug induced SLE what we have anti-histone. Anti-neuronal, it will be responsible to cause CNS symptom. And anti-P for Pugly, psychotic symptom. Psychotic symptom will be because of P. Done? So this is something which you have to remember about SLE. Right? ओके, विल्सन डिसीज से भी क्वेश्चन पूछते हैं. बेसिकली दे आस्क यू क्वेश्चन ऑन मैनेजमेंट पार्ट. सो वी हैव 4 ड्रग्स विच यू हैव टू रिमेंबर. जिंक, डी पेनिसिलामिन, ट्रायंटीन, देन टेट्राथायोमोलिब्डेट. So these are 4 available options. Drug of choice will be zinc. Emerging future drug will be tetrathiomolybdate. Now coming to, suppose if patient is very sick, then we calculate a score called Naser prognostic index. Or Naser prognostic index की value, if it is more than 9, then understand, then it's the indication. Now what we do liver transplant. So just remember this name, Naser prognostic index. Done? ओके, ना अंडरस्टैंड. अब हाइपोथायरॉयडिज्म से आपसे क्वेश्चन कैसे पूछते हैं? सो दे आस्क यू बेसिकली क्वेश्चन ऑन डायग्नोस्टिक पार्ट. सो जस्ट आई एम ट्राइंग टू मेक few things for you. Just try to make a diagnosis. So they will give you T3, T4, TSH value, and then they will ask you to make a diagnosis. T3, T4, TSH. Okay, so try to answer. T3, T4. Suppose if I say T3, T4 are more, this will give a feedback. So TSH is less. T3, T4 बढ़ा हुआ है, feedback से TSH कम हो गया. So T3, T4 are increased. It means problem is in the gland. What we call this? We call this primary hyper. But if I say when TSH is more, that's why T3, T4 are more. So इसको क्या बोलेंगे? Secondary hyper. Done. Okay, now coming to T3, T4. T3, T4 are low. This will give a feedback. So now TSH is high. So again, T3, T4 are low. So feedback is going, TSH is high. So feedback is going. So this is called as primary hypo. But again, when TSH is low, now this will cause low T3 and low T4. Low T3 and low T4. So this is called as secondary hypo. Clear? Now this fourth one you have to tell, fifth one you have to tell me. ये तुम्हें बताना है मुझे. You need to tell me this. बताओ क्या है? Tell me what is the diagnosis here. What do you think about this thing? बताओ, what do you think? प्राइमरी होगा ये? नो. What do you think? देखो ध्यान से, look at the screen carefully. T3, T4 are normal, TSH is increased. इसको बोलते हैं सब क्लिनिकल. सब क्लिनिकल मीन्स patient is having disease but symptoms are not there, right? Subclinical. Okay, now moving to NYHA. NYHA, remember this NYHA is New York Heart Association. We use for heart disease, and Modified Medical Research Council scale. This is something we use for lung disease. So these are dyspnea scale that we use for heart and lung disease. So see, class 1 low limitation, class 2 slight limitation, class 3 marked, class 4 symptom at rest. Simple. Now coming to Modified Medical Research Council, देखो one look like hill, so dyspnea on uphill. Two means comparison, दो लोग हैं, so walk slower than contemporaries of the same age, means अपनी उम्र के व्यक्ति से same. 300, if you write 100 like this, 100, 1 2 3, 100 meter patients having dyspnea. 4 means floor. 2 dyspneic to leave the house means dyspnea at rest. So this is called grade 0 is normal, so 0 you can skip. Okay, now moving to different types of pulse. What are the different types of pulse you can see? What are the different types of pulse you can see? So first type of pulse you can see, let's start with this one. This is called as Corrigan pulse. Corrigan pulse और water hammer pulse. अब मुझे बताओ कहाँ मिलती है? Where we see this pulse? Corrigan's और water hammer pulse. Where we see this? Corrigan pulse or water hammer pulse. It is something which we see where? Where we see? Anyone? बताओ कहाँ मिलेगी Corrigan pulse? AR. Corrigan pulse you will see in a patient with AR. Okay, moving to pulses. Bigemini, even trigemini. Bigemini, trigemini. Where we see bigemini, trigemini? Shubham, Debaki, Kasan, Tarun, बताओ. where we see bigeminy, trigeminy. This is seen in digitalis or digoxin toxicity. Digitalis toxicity. This is called pulsus alternans. Pulsus alternans. So this will be seen in any condition causing left heart failure. Any condition causing left heart failure. Now see, Bispherians necrotic pulse. So you can see here, you will see two peaks, but both peaks are in systole. Here you will see one peak in systole, second is in diastole. एक systole में दूसरे diastole में. So this is called as bispherians. Bispherians you will see in a patient with AS plus AR, in a patient with HOCM. Necrotic कहाँ मिलेगा? Where will you see necrotic? You will see in DCMP. You will see this in sepsis patient, in typhoid patient, right? Am I clear? And this is called anacrotic pulse, or anacrotic pulse को और क्या बोलते हैं? We call this parvus et tardus. Pulsus parvus et tardus. This is something which we see in AS. So these are the different types of pulse. Very very important. Okay, then remember this, like ये photo बार बार एग्जाम में आ रही है, so I thought to add this important. You can see this, you can remember by mnemonic. All people enjoy. Enjoy means यहाँ पर एक और area होता है, that's called ARPS area. So this area is called as ARPS area. ARPS area also called as neo-aortic area. So remember, all people enjoy. Time magazine. All people enjoy means all means aortic, pulmonary, ARPS, tricuspid, and what we have, mitral valve. Okay, then these are the different types of crystal shapes which you can study from your surgery or your medicine notes. Again, they ask you in exam. Struvite, like calcium oxalate, most common type. Then you can see uric acid, rhomboid shape. In outpatient, struvite, coffin, lid shape, cystine, hexagonal. Very hard. This is like hardest stone, very hard to break. अब देखो ये बार बार क्वेश्चन पूछते हैं, like which virus can cause. So remember, Epstein-Barr virus can cause Burkitt lymphoma, organ transplant lymphoma, primary CNS lymphoma. HTLV1 will cause adult T-cell leukemia. Hepatitis C will cause. This is ये क्वेश्चन नहीं आया, बाकी सारे आ चुके हैं. See, except this, every question came in exam. This is the expected now. Then H. pylori will cause gastric maltoma. HHV8 will cause Kaposi sarcoma, effusion lymphoma, and Kesselman disease. Color coding means किसमें क्या रखते हैं. So just remember, like clotting study, or I can say this parameters we keep in blue vial. For purple is used for, like we call this purple vial or EDTL vial for CBC. तो CBC के लिए पर्पल यूज़ करते हैं. फॉर बायोकेमिस्ट्री मोस्टली वी यूज़ रेड वाइल्स, राइट. फॉर ESR वी यूज़ ब्लैक, एंड फॉर ग्लूकोल एस्टिमेशन व्हाट वी नीड ग्रे वाइल्स. सो दिस इज़ लाइक अ टेबल मैंने ऐड कर दी है. ये जेनेटिक्स की एक टेबल है. दिस PDF विल बी शेयर. सो मैं इस चीज़ को भेज देंगे सबको. सो दिस PDF यू कैन सी दिस इज शॉर्ट वन क्वेश्चन इन एग्जाम. So like they ask you either three type of question, either one liner, or they can ask you all are autosomal dominant except, all are autosomal recessive except, or they will give you a clinical case and they will ask you what is the diagnosis. Then second table, important table, is this hypersensitivity table. Again this is also one MCQ in exam, very very important. तो देखो दो क्वेश्चन तो ये हो गए in this page, very very important. This congestive hepatopathy, like we also call this chronic passive congestion of liver, or in pathology what we call this nutmeg liver. TTC test, triphenyl tetrazolium chloride red. You can see this is like pale yellow color. This yellow color will be the ischemic area, and you can see this red area. This red area is viable tissue. This brick red color this will be the viable tissue or non-ischemic area. Then this is like you can see pulmonary lung disease. So patient को क्या होगा, pulmonary artery hypertension, ultimately it will cause respiratory failure, and with this patient will die. With this patient will die. Then you can notice patient can develop high BP. We call this renal crisis. In the skin you can see calcinosis, digital ischemic ulcers, and because of this ulcer sometime you will see this suppose ulcers are here in the fingers, you will see the bone or the digit part, this bone will break down. We call this acroosteolysis. Then you can see a very small nose or a small opening of mouth, microstomia. So you can see these are the fingers, absence of folds on back of finger, we call this sclerodactyly. Microstomia means you can notice small opening of mouth. Then this is called leather like skin. The skin will look like leather, and this is called acroosteolysis. So these are all the MCQs which we see in a patient with scleroderma. Okay, this is Raynaud phenomena. You can see color change sequence. So initially it is pale. Pale means white. Cyanosis means blue. Red means red. So remember PCR. Pale, cyanosis, red. Pale, cyanosis, and red. So in this slide you can see all the MCQs of rheumatoid arthritis. You can see secondary Sjogren syndrome. Most cause of death will be cardiac disease. Then you can see there will be membranous nephropathy. Then patient can develop this question they ask in exam. Most common anemia. Most common will be normocytic normochromic anemia. So these are all the MCQs of RA. RA means rheumatoid arthritis. A very beautiful table from a research. Sarcoidosis, to understand, you will see patient will have most common organ lung. Then you can see different bodies like Schaumann bodies, asteroid body. Then you can see non-caseating granuloma, skin rash, lupus, pernio. Then patient will have fever, parotid gland enlargement, uveitis, facial nerve palsy. इसको बोलते हैं Heath-Fort syndrome. Then you can see fever, erythema, bilateral hilar lymphadenopathy. We call this Lofgren syndrome. So these are two syndrome associated with sarcoidosis. Increase in level of ACE, increase in level of calcium. Gallium-67 scan will have panda sign. पहले टेस्ट करते थे, previously we were doing this test, but now we don't do. We call this Quame test. BAL means bronchoalveolar lavage. So here you will see CD4 is to CD8 ratio. CD4 is to CD8 ratio will increase. And we have scattering scoring score that is based on X-ray. These two are X-ray finding. In X-ray what you will find Garland sign, or we call this 1, 2, 3 sign. So these are all the MCQs on sarcoidosis. Moving to last thing. So fasting blood sugar, hypertension. Fasting blood sugar means diabetes, hypertension. Abdominal girth is more than 102 in case of males and more than 88 in case of females. Then we have two lipids. Now understand. So what are the meaning of two lipids? So first lipid will be triglyceride more than 150, and second lipid will be HDL less than 50 in case of female, less than 40 in case of males. So diabetes, hypertension, obesity, lipid. तो याद रखना ढोल. तो ये ढोल है, एक ये ढोल है. So if you see any three or more symptom, we call this syndrome X. Syndrome X or metabolic syndrome. Syndrome X or metabolic syndrome. Okay, moving to all the score. So MELD score, what we have creatinine, bilirubin, INR. PELD score, it is, you can remember by mnemonic, nutrition status, INR, albumin, bilirubin, albumin, age. तो उसको कैसे याद रखोगे? निब्बा. नेजर इंडेक्स, यू कैन रिमेंबर, SBI, Madris, BI, and child book ABCDE. Now what is ABCDE? Understand? In child book what we have? A for albumin, B for bilirubin, C for coagulation. Coagulation study means PTINR. D for distension. Distension means distension of abdomen, that means ascites. And E for encephalopathy. Sometime examiner will not give the term encephalopathy. What they will give you? They will give you flapping tremors, and these flapping tremors are called asterixis. So these are the asterixis, flapping tremors. Done. Okay guys, so now I have made a list of few topics, so I'm just writing these topics. What are the topics which are asking again and again routinely in exam? So even I'm making a video on this topic. I am just reading out for you. I'll make a separate video for you. What are important topics which are coming in recent, I can say, 3 years. So ABG analysis, heart block, मैं लिख ही देता हूँ यहाँ पे. So what are the expected topics? Just I am writing here which are trending. So just I made this list to show you what are this list of topics. So starting with the first one, first topic, important one is ABG. I know time is very less, so you have to remember these important topic. ABG analysis very very important. Then heart failure, इसको अच्छे से पढ़ना एक बार अपने नोट्स से. Atrial fibrillation, CSF, meningitis, very very important. Guillain-Barré syndrome, Zollinger-Ellison syndrome. Then oral hypoglycemic agent, anemia. देखो anemia से अभी क्वेश्चन ज़्यादा आ रहा है. They are not asking leukemia more, they are asking you anemia more often. Then remember cardiac markers, very very important. Then what we have? Anti-epileptic drugs, anticoagulant. Then next what they ask you? Alcohol withdrawal. अल्कोहल से कुछ ना कुछ पूछ ही ले रहे हैं, तो साइकेट्री से अल्कोहल ठीक से पढ़ लेना. वेरी वेरी इंपॉर्टेंट. कार्डियक टेम्पोनेट, ब्रोंकियल अस्थमा, माइग्रेन, पल्मोनरी एम्बोलिज्म, स्मॉल सेल लंग कैंसर, ओबेसिटी हाइपोवेंटिलेशन सिंड्रोम, रीनल ट्यूबुलर एसिडोसिस. RTA से क्वेश्चन देखो, MCA में अभी नहीं आ रहा लेकिन पहले बहुत पूछते थे. मल्टीपल माइलोमा, एमिलॉइडोसिस, रोमैटिक फीवर, DK, acromegaly. There is a short topic called Gaze-Box syndrome. Even like in my Instagram, I am also making small reels of these topics. This is very very important. So these are the list of topics which are frequently asking in exam. ये कुछ वो टॉपिक है जो आपको पढ़ने एग्जाम से पहले. So with this we will conclude our session. तो I hope you are studying hard. ज़्यादा टेंशन नहीं लेनी, बस 10 घंटे रोज का पढ़ना है. So I wish you all the best. Just keep the hustle on. Remember, you can, you will. बस पढ़ते रहो, पढ़ते रहो. All the best.